They've given me a call because they're really worried about a Staffordshire Bull Terrier called Rosa. So I need to go up to investigate, and I really hope there's something that I can do to help.
Hi, Scott.
Hi, Sonia.
Animal rescuer Sonia is waiting for Scott.
I'm fine, thank you.
Now, here you've got a pretty sad case to come and see me today.
Yes, you're here to see Rosa.
I'd love to see her,
Lovely
yeah.
little Staffy, but
good.
in quite a bad way.
Oh, dear.
Today, there's a full house of abandoned dogs which need new homes.
Wow, you've got lots of dogs in at the moment, haven't you?
We've got a few puppies in.
Yeah.
And then we've got Rosa up here.
Hello, Rosa.
Hey, Rosa.
Hello, beautiful girl. How are you?
Rosa was picked up by the dog warden after being found wandering the streets of London.
Hello, gorgeous. So yet again, another stray Staffy, hey? Very overrepresented breed, aren't they?
Unfortunately, it's very common with Staffies. Most of the dogs that come into rescues are Staffies or Staffy types.
I think Staffies get dumped so often in rescue centres because the people that think that's a perfect dog for them are not getting them for all the right reasons. People should want a dog for the companionship, for the love and the affection that the dog gives. But some Staffy owners see them as literally a status symbol. They haven't thought about all the welfare needs that this dog has, and very quickly they realise that they can't keep the dog. They then throw it into a rescue centre, and that's where they languish.
She's very, very happy.
Yeah, although very, very thin. Look at all those ribs, Rosa, hey? You need some feeding up, don't you, my love? Hey?
I don't understand people that can dump their dogs. I can't get my head around it at all. Rehome it the proper way. There's people around to help these days. You don't need to abandon your dogs.
Hey, look at you. Aren't you just lovely?
Oh, lovely Staffy smile.
Look at that big smile you've got, hey?
She's quite a happy little girl. Just hoping that we can get her a perfect family.
But first, Scott is giving Rosa a total health check. Apart from being underweight and suffering superficial skin problems, Scott soon discovers a far more worrying issue.
There's actually some hard lumps present along the strip of mammary tissue here. Can you feel those?
Oh God, yeah, I can really feel really hard lump.
Yeah. So basically, she's got lumps in her breast, which, for any female is concerning. It's not something that we can just quickly remove and go, oh, yes, that will be absolutely fine. We need to look into this, understanding what kind of lumps they are and whether they'll affect her future.
Okay.
Scott is guessing that Rosa is about 8 years old. It appears she has been used for excessive breeding before being dumped.
Overbreeding is fairly common in Staffies, unfortunately. They are bred by unscrupulous breeders. They are bred every single season, so that means every 6 months, these poor dogs can be having yet another litter of puppies. So I think what we're going to have to do is take you to Leafy Richmond, check her over and see how she's going, and make sure that she is going to have her forever home.
Oh, thank you. Hey. Rosa's going to make a perfect pet for somebody. I love her. Really love her. I'd love to take her home myself.
Yeah, that's a killer. That's a killer of a dog, isn't it?
Goodbye kiss.
Oh.
We'll see you soon.
So do you want to come back to Richmond with me? Hey, beautiful Leafy Richmond? Hey, or do you want to crawl back to Richmond?
I think she does.
Crawling back to Richmond, it's a bit of a distance.
Go on then, you go first.
At home in Isleworth, southwest London, one of Scott's long-term patients, Domino, is enjoying some fun and games with the family.
Domino's 15 years old, and we got him when he was 8 weeks old. My dad arrived with a cat carrier with 2 kittens inside, and he said he had a present, one each for his grandchildren. They fell in love with them. I couldn't say no, and we ended up with Domino and Licorice.
But while Licorice likes his own space, Domino loves being the centre of attention.
Good boy. He's very spoiled, and I think he thinks that he is a human rather than a cat. Domino, no.
But 6 months ago, Domino suddenly became ill.
He went from being a really big, chunky, fat cat to a complete bag of bones within 2 weeks. And we were frightened to go to the vets because we thought they're going to put him down.
What's that, mate?
Blood tests revealed Domino has a condition common in older cats, known as hyperthyroidism.
You having a little massage? You like a little massage?
One of his 2 thyroid glands is overproducing a hormone called thyroxine. The excessive hormone pushes up his metabolism, causing extreme weight loss.
Domino. Sometimes.
The elderly cat has now been on medication for 5 months.
In it goes. Come on, it has to go in. I hate giving Domino his medication. Domino hates me giving him his medication. He hides. He will spit the tablets out if he can. No, don't break my fingers.
If that wasn't bad enough, recent tests show he's not responding to the medication.
There's a good boy. I know you don't like it.
Scott has now told the family Domino needs surgery to remove the abnormal thyroid gland. But there are serious risks involved in a 15-year-old cat going under a general anaesthetic.
I'm hoping for Domino to come out the other side and be happy and healthy and get back to his normal self. But we don't know if that's going to happen.
The family will have one last night of cuddles before Domino's big surgery tomorrow.
Oh, is that nice? He likes that. Yes.
This way. Come on, Rosa. Let's go meet the team, shall we? Oh, you're keen. Come here.
Scott's arrived back in Richmond with little rescue dog Rosa.
Hi, Rosa.
The friendly Staffy is an instant hit with receptionist Kirsty.
Kirsty, a kiss. Hey.
Sit on my lap. You comfortable? Oh, you're lovely, aren't you?
She's beautiful.
You're so friendly.
I know. All right, well, let's get you off Auntie Kirsty's lap, eh? And go and check out those lumps. Come on, Rosa.
Oh, bye, Rosa.
Good girl.
Scott's concerned about lumps in Rosa's mammary glands and plans to remove one so it can be tested.
So this is Rosa. Oh,
Rosa.
good girl. Gorgeous.
Oh, hello.
Frisky.
Full of energy, eh?
Hi.
Assisting Scott are head nurse Emma and newly
Oh,
graduated
my
vet
goodness.
Riaz.
She is clearly a dog that's been bred a lot.
Oh, honey. I definitely feel it on my heartstrings when a neglect case comes in. Having animals myself and being such a big animal lover and doing what I do, I just can't put myself in the mindset of other people and how they could want to harm them.
Unfortunately, there's absolutely no history. She was just found roaming around and was brought into the rescue centre.
You must have had an owner at some point, surely.
All right, guys, well, I'll leave you to get her ready for surgery and I'll be down in just a sec and we'll get cracking.
Brilliant.
Good stuff.
This is Riaz's first job out of university, and already he's discovering plenty of challenges.
I'm not really used to seeing rescue dogs because the way that we've been taught is to always get a good history and take it from there.
What a brave girl.
But when it's a case like Rosie, you just have to sort of do the best you can and, you know, put the animal's needs first.
Time to go to sleep, baby. Good girl.
We're good to go.
All right. So the big concern for this little lady is these mammary masses. And we can feel them running up these chains of teats. And unfortunately, now she's knocked out, I can even feel one at this top one. To remove all of them is a massive surgery for her to undergo, and we don't want to put her through that unless we absolutely have to. So what I think we need to do is just take just one of them away, and at the same time, we'll then spay her. And what that will do, of course, is reduce the stimulation to the area.
The hormonal
Exactly,
stimulation.
yeah. And as a result, hopefully cool down the growth of these masses, whatever they turn out to be.
Okay. And the most striking thing that we found was the number of masses. Normally, you might find one or two at a dog which is that age, which hasn't been spayed. But to find the sort of number that we did, it was quite striking.
Everyone ready to go? Okay. Yes. All right, so we just need to keep our wits about us.
Scott is carrying out the spaying on Rosa first.
Actually, her being quite skinny is quite useful, actually. It's quite easy to see what we need to see.
The spaying is routine.
Okay, I'm happy with that.
And Scott can now move on to the lump removal.
I should be able to remove that fairly easily, and actually I'm going to do it through the incision line I've already made for the spay. So I'm just going to incise over it now, kind of pop it out like a pea out of a pod. It's very pretty, it's very nice.
But now that he can see the lump, Scott is starting to worry that this part of Rosa's surgery isn't going to be as straightforward as he'd hoped.
Though it feels like it should just pop out, it's very tightly adhered to the tissue surrounding it. It's very angry looking, very nodular, very hard. It worries me, I've got to be honest. It just doesn't look good. Right, Riaz, what I need you to do for me is just pop your 2 fingers underneath and around it. Put a little bit of pressure against it for me.
At the Richmond surgery, Scott is becoming increasingly concerned that rescue dog Rosa may have breast cancer.
Something a little bit worrying.
The little staffy was almost certainly used to produce multiple litters of puppies for profit.
I'm not that happy, if I'm honest, because I was really hoping that it would just be relatively innocuous looking, hard white ball that was just going to pop out and look very, very innocent. But in fact, what I've found is something that looks quite aggressive, just nasty. Okay, all right, there we go. So now we've taken this little bit of tissue out and the lump. What we're going to do is then send it off to the lab. I really don't know what it is right now. It absolutely could be cancer. Oh, that's you get. Good girl, well done.
So there's sort of 2 types of tumours. The 2 types that Rosa's could come back as are either benign or malignant. The benign ones don't really spread and do too much damage unless they get really big. The malignant ones have the ability to spread to other tissues and sort of do damage elsewhere, which could compromise Rosa's life.
Oh, good puppy. This is normally the time we call an owner, but sadly, you don't have one. So I'm just going to have to take on that role for a while, hey?
I think while Rosa is here in recovery, she is going to get all the love in the world. The nurses have all fallen in love with her, and already they're dying to go in and give her a cuddle once she's recovered fully.
Hey, poor baby. I think we're just going to keep Rosa close by until we can understand what's going on and what we need to do to try and save this beautiful dog. Poor Bubba. Yeah, I love you too.
Hello. How are you?
We're good, here he is.
Gorgeous.
Next day at Scott's Isleworth practice, it's time for Domino's thyroid surgery.
You going to come out and see us? Domino has a very classic condition of older cats here in the UK, which is hyperthyroidism, an overactive thyroid gland. Basically, a benign type of tumour grows on the gland and then increases its production of thyroid hormone.
When the abnormal thyroid gland is removed, it should reduce Domino's hormone levels and allow him to feel good again and start putting on weight.
How are you feeling about it? You all right?
A little bit nervous, but, you know, looking forward to it at the same time.
Yeah, he doesn't seem nervous at all, though, does he?
He's not, no.
Seems pretty chilled.
Tracy is understandably nervous about being separated from Domino.
When Domino was 18 months old, he just disappeared. I was really upset during that time. The children were very upset, and it was difficult for them because they were so young, they couldn't understand why he'd run away from home.
But to the family's amazement, after 3 long months, Domino had been found 70 miles away in seaside Brighton.
And he went all this way, look, right on the seafront. It was unbelievable. I was extremely happy, but absolutely in shock at the same time. I didn't think I was going to see him again. Oh, Doms, I love you. You're my mate, aren't you? I feel like he was supposed to be with us, and now he's sick. I have to do everything I can for him because the bond between us is just so strong. I'm off because I'm going to get upset. I'll see you later.
See you later, Trace. All right, have a good day.
Bye. Bye. Thank you.
You can tell with Tracy that there's real deep-seated emotion here. She's already lost this cat once, and this time round I know that she has a sense that she might lose him again. Yeah, it's weird to think you're going to lose your thyroid gland, but it will help because at the moment it's just behaving badly. So we just need to take it out and go home to Mummy without nasty tablets every day.
Head nurse Emma is assisting Scott.
Good boy. Little scratch.
Good.
And they're both very impressed with just how easygoing their 15-year-old patient is.
Such a gent, isn't he?
He's such a chap.
For his age as well.
He's certainly not doing the cantankerous old man thing, which, quite frankly, I'm quite looking forward to doing.
Oh, no.
Yeah, I can't
You're
wait.
bad enough on a good day. Can you just...
I'm very chipper, but I'm looking forward to being a grumpy old man. I think that'd be actually quite fun.
Jokes aside, Domino's age could pose serious problems for the anaesthetic.
I'm really glad that I've got Emma, my head nurse today, here with me because she's the most experienced nurse that I have. And in these cases where you've got an older cat that has lost a significant amount of condition over the last few months, they are going to be an anaesthetic risk. There's no doubt about that.
I do basically have to keep Domino alive. That is my job. I'm the anaesthetist. So if anything goes wrong, it's on me.
How are we getting on?
Well, he's bradycardic and his blood pressure is quite low.
Okay.
So no pressure, but quick as can. I'm just nervous.
Come on, up you get.
Close by in Isleworth, an unlikely friendship has blossomed between a local gardener and a rescued parakeet.
I saw this thing fall out of a tree next to me, and it literally landed, not that far away from me. But I knew there were cats and foxes in the garden, so I just picked her up and then I plonked her on my shoulder. And ever since then, we've just sort of been together.
Luan immediately gave the little parakeet a name.
As soon as I saw her, I just thought Pablo, without even knowing if she was a male or female. But from day one, I felt very affectionate towards her, and she seems to show a lot of affection back to me.
The two are now inseparable, and while Luan has given the bird a safe home, Pablo has given his rescuer a new life.
Last year, I've been dealing with a lot of anxiety.
So how's Pablo doing today?
And since I met Pablo, it's given me that extra confidence to meet people and go out, socialise again.
Does she have a favourite shoulder?
She does, and it's this one. I can't really think of life without her now, even though it's only been 3 weeks. It sounds crazy. Oh, yeah.
But today, a worried Luan is taking Pablo to Scott's Richmond practice. His new friend has a noticeable problem with her right leg.
I knew from day one that there was something up with her because she wasn't flying around and, she wasn't behaving like the other birds. And yeah, I just wanted to see if she gets better.
Hello.
Hi.
Hi, how you doing?
Not bad.
How's Pablo sleeping?
Vet Joe will be looking after
do
the
you wanna bring her
exotic
through?
patient today.
Do you want to come through?
Sure.
Some people will see parakeets as a pest. She's not an indigenous native species to the UK, but in her case, she is a pet to Luan, and they obviously have a very close relationship.
She still uses her leg, but she doesn't really...
She doesn't grip
grab
very
it,
well,
no.
does she? So I'm just checking whether she's actually able to use the foot to perch. She's obviously using the left leg a bit more.
Yeah, since I found her, she's been like this.
Pablo needs an X-ray, so Joe can find out exactly what the little bird's injuries are.
She might have a fracture there, and infections can get into the joint. To get good views, we need her to stay still, so we'll just give her a little bit of anaesthetic gas.
Okay. I'm remaining hopeful and optimistic, but yeah, I'm worried.
Okay, so if you want to wait for a little bit, and then I'll update you shortly when I've got some X-rays.
Okay.
Okay. Go on then.
Yeah, it's a bit of a tricky anaesthetic, I'm not going to lie.
In Isleworth, Scott is about to start surgery to remove Domino's abnormal thyroid gland. But already the 15-year-old cat is giving head nurse Emma plenty of concerns.
His heart rate is a little bit slow. His blood pressure is much lower than I would like it. Yeah, it's keeping me on my toes, that's for sure.
Trainee nurse Gemma has been called in to help Emma if required.
Nice, healthy white nerve there. I'm going to avoid that like the plague.
Scott is also feeling the pressure.
There's some huge nerves that do very important things, controlling everything from the ability to swallow to the ability to move your tongue, even the ability to move your neck. So really, really important nerves there, and you definitely don't want to cut any of those. There you are. There's the gland there. So at either end I can see a nice clear parathyroid gland, and in the middle there is the thyroid gland, which I'm going to remove. So what we're talking here is a matter of millimeters between what is abnormal thyroid tissue and what is healthy parathyroid tissue. So I do need to make sure that I place the ligatures in the right spot and take out all of this gland, otherwise it will simply just grow back. You're sort of pretty happy with the cat now, James?
Yeah, it's stable, but it's keeping me on my toes.
Okay, so that's one abnormal thyroid gland. So this has come out nice and cleanly, and I'm ready to close.
Cats have 2 separate thyroid glands. Domino's remaining gland is healthy and will now control his metabolism, hopefully eliminating the need for any further medication.
And we are done.
Thank you.
Yes.
Never been so happy to finish surgery with you.
A relief to get this boy woken up.
Yes.
Come on then. Back you come. You've been back to Brighton in your dreams, eh?
Walks on the beach. Welcome back, buddy.
-1 pesky thyroid gland. Hey.
Never been so happy to have a cat wake up so quickly.
Yeah, good boy, Domino. Well done. Surgery went really well. The gland was abnormal looking, but I feel that I got it out completely. Oh, what a nice, cozy bed.
Snuggly.
Emma was just happy it was over. She was happy she could wake up her cat and have her patient alive and breathing in front of her. So thankfully, we were both happy with the result.
I want to get in and snuggle with him. It's
I know.
quite cozy in there.
Looks super cozy in there.
I know.
Probably quite happy you jumping in there. He's probably a dirty old man.
Stop it, you. Behave.
Hey, do you want Auntie Em to jump in for a cuddle? Hey? Bet you do, little monkey.
A few hours later, anxious owner Tracy has arrived at Isleworth to collect her little man.
Hello. I was worried about Domino all day today. He was just in the back of my mind all the time. And I couldn't wait to finish work to come and collect him.
Domino, look who it is.
Hello.
There's Mummy.
Hey, yeah. Hi, Dom-Doms. How are you?
For such an old boy, he's woken up brilliantly. Surgery went very well. He no longer has the thyroid glands on the left side, but hopefully now he'll have a life without tablets, which would be great.
Oh, that'd be wonderful. Hey, babes. Oh, I missed you today. Oh, I'm so happy. I'm really pleased that everything went well, and I can't wait to watch him put on some weight and just chill out and be happy.
All right, buddy. You ready to go?
All right, Trace.
Thank you very
Take care.
much. Thank you.
Bye. Bye,
Come on,
Domino.
Doms, let's go.
So I'm guessing she's friendly.
Yeah, she's very friendly.
I think you turn into like the exotics vet now. You don't often get birds here.
At the Richmond Hill surgery, Joe and nurse Nathan are about to x-ray Pablo the parakeet's injured leg.
Well, I'm worried there might be a fracture there. We'll have a look at the x-rays and have a look, but it's definitely that hop joint that's a bit swollen and why she's holding up the leg. Okay, we're looking a little bit sleepy. Lights. X-rays. Nath,
Yeah?
I think it's a really bad fracture. You can just see the fracture there.
Wow.
So this isn't good news for Pablo, and it's definitely not what I was hoping to find. I thought that it would be a smaller fracture lower down, where the bones were probably starting to heal, perhaps, but no, this is a big fracture, so it's a lot more serious than I thought.
Joe now has to tell Pablo's owner Luan the bad news.
How is she?
She recovered from the anaesthetic really well, really quickly. But I'm afraid the x-rays didn't give us the news that we wanted.
Right.
The fracture's quite high up. Surgery is an option. She's healthy, she's good weight, she's eating, and so, her chances are reasonable, but bird anaesthetic is really risky.
I thought it was going to be very straightforward. I thought she might need some medicine or even some physio. And no, it's very disappointing. I have to give it some thought, but I probably will go ahead with the surgery.
Okay.
Although Luan is nervous about the surgery, Pablo has quickly become his best friend,
Very soon,
and he'll do anything to
brilliant.
help her.
I want to give her the best fighting chance. She sort of turned up at the right time. She's helped me with an awful lot, and now it's my time to help her. Here we are, Pabs.
Next day, Luan is bringing back Pablo the parakeet for an operation to fix the bird's
Not bad.
badly
You okay?
fractured leg.
How's Pablo?
She's all right. She's here to see Scott and Joe.
Yeah, do you want to have a seat? They'll be right with you.
It was a clear choice to go ahead with the operation, but today's going to be a real difficult day.
Hi, Luan.
Hiya.
This is Scott.
Hi, Luan. How are you? Nice to meet you. Hello, Pablo. Aren't you gorgeous? All right, well, it's a big day, so let's go in and have a chat, shall we? Come on in. When Joe first showed me the x-rays, it was very clear that this was a fracture that needed to be fixed. There's two sharp ends of the femur, which is the thigh bone in the upper part of the leg, and they were broken in half and folded over. It's a pretty nasty break in this right leg, isn't it?
Yeah.
How are you feeling about that?
I'm upset to hear that, she's got such a serious fracture, but, I want to do the best for her, so go ahead with the operation.
Okay. The main concerns for us is the anaesthetic. But the problem we have with her is that she is going to need to be under anaesthetic for quite a while, for maybe anything up to an hour.
Yeah.
And that is always risky in birds. So we are quite concerned about that. And then, of course, she's a young bird. And as a result, her bones aren't fully calcified and as hard as they should be. Mm-hmm. And so that will mean that there's chances that whilst placing a pin, they may fracture.
Literally in the last 3 weeks, we've bonded so much and so quickly. And the fact that there's such a risk that I might lose her, it's been difficult. Good luck, Pablo.
We will give you a call as soon as she has woken up.
Thank you very much.
Take care. We'll see you in a bit.
See ya. Bye. I'm expecting the worst, but I'm hoping for the best.
I hear she's not doing so good on one of those pins.
Yeah, so the right leg has got a fracture, and that's what we're all here for today.
Head nurse Emma is teaming up again with Scott, and vet Joe will also be assisting.
Okay.
We know there's risks, and I know that we all are nervous. I mean, I'm feeling nervous. I know that you guys are as well.
Yeah.
But all we can do is just do our very best. So we're breathing there, fine. So you can see the small light breaths there, okay? So now every 15 seconds, you're breathing, right?
Yeah.
Every second the tiny patient is under anaesthetic will be critical.
Birds are very delicate little creatures. They're very prone to stress. And under anaesthetic, they can just simply die. So it is a very nerve-wracking thing to knock a bird out under anaesthetic, and we need to make sure that we're all on our A game today. There we go, so knee there. I'm just feeling the fracture site properly for the first time. She's just so stiff. This fracture feels a lot different to what it looks like on X-ray. The muscles are so tight here that they've actually pulled this fracture underneath its knee. So it's like having its hip joint and its knee in the same position, which is clearly not correct.
Scott is now seriously rethinking his surgery plan.
Unfortunately, I can't see how I'm going to fix this surgically, because to do so, I basically have to refracture the leg.
Is amputation an option?
I don't think we need to. The reason I don't think we need to is because she can feel her leg. She can feel her leg, she can place her foot, she can hold the toes around my finger. So I'm feeling now that actually we should pull out and we should allow her to wake up, because I think that the fracture has healed, however badly. And I think that, Luan loves this bird, and I don't want to be the one that breaks his heart. Hello, sweetheart. This doesn't happen very often. I'm just about to operate, and then I make the decision not to operate. But as a vet, you do have to balance the risks of a procedure versus the potential benefits, and also remind yourself that just because you can perform a procedure, it doesn't mean that you should. And I know that I'm making the right decision in this case. Welcome back.
I think she's hungry.
She's like, get off my leg. I wanted to have a perfect leg, but hey. It seems from the examination that we've done today that Pablo isn't in any pain. There isn't any chance that those sharp edges of the fracture site could cause any further damage. The healing's been done. It's not perfect by any means, but it's perfect enough.
Hey.
Here we go.
Oh, how'd it go?
Well, it was eventful. Your bird has something we're going to newly describe as a fifle, which is basically a very odd leg, knee, thigh joint.
So it's just a fused callus, so it'll always be deformed and she'll always have that kind of claw-like perch. But she can still perch and she's not in pain.
And is that not risk of infection or anything like that?
No, because the fracture is on the inside. The slightly sharp bit of the fracture that we can feel is on the inside of her knee. So it's protected from anything on the outside.
And it's great that we've been able to give it back to you in one piece. And that's exactly what we wanted to do. And we know that we've gone through the process to try and give her the best treatment we can. And actually, it turns out by doing nothing is the best treatment we can give her.
I really wasn't expecting a happy outcome, if I'm honest. I mean, I know I said I was remaining hopeful and so on, but just the chance of her not making it, I'm really happy. She's in good health and her foot's healing itself naturally, and that she can come to work with me tomorrow again, back to normal.
How's she going, girls?
Hi. She's, yeah, she's very, very flat.
But while there's a happy outcome for Luan and Pablo, later that week, rescue dog Rosa has taken a sudden turn for the worse. The pathology results are back from the suspicious lump that Scott removed from Rosa's breast tissue.
All right, there we go.
And they show that, as feared, it is cancer.
You love a good kiss and a cuddle, don't you? Yeah, you do. Yeah, you do. Rosa, our beautiful Staffordshire Bull Terrier, is really not doing too well today. She is flat. Emma's been working with her all through the morning.
It's not how it was supposed to be, is it? It's not what we talked about.
With Rosa deteriorating so quickly from the rapidly spreading cancer cells, Scott has taken new x-rays.
Sadly, down the bottom here, there is this, and that looks like to be chest met, which is a metastases, which means that the tumours that are present in her breast tissue have spread to her lungs, which is gutting because it means that no surgery in the world is going to save Rosa. It makes me so angry that someone knew that this dog had those lumps there and simply did nothing about it, because if they did do something about it, then Rosa's life could have been saved, and that is just awful.
Hey, beautiful one. Hey, I bet you're a gorgeous little puppy.
Head nurse Emma and receptionist Kirsty are maintaining a vigil at Rosa's side.
You've become such a big part of the family. Everyone has just fallen in love with her, haven't they?
Especially me. I feel really devastated, to be quite honest. You know, I've come to get really quite attached to Rosa and, you know, considering adopting her myself, and it's absolutely heartbreaking.
Tough decisions will soon have to be made to ensure Rosa doesn't suffer.
I think the most important thing that we always have to remember is doing it for her.
Yeah, definitely.
I don't think this part of the job ever gets any easier. I think it always hurts. And I think the day that it stops, I'm not doing my job right.
Soon after, Rosa lost her battle. But she leaves a lasting memory.
Look at that big smile you've got, hey? Rosa signifies what we all love about dogs, the fact that she gives unconditional love.
Oh, good girl.
Regardless of her history and what's happened before, she loved us. And I hope that we've given her a little window into how normal dogs live, which is where they're loved.
Later that afternoon, two unexpected visitors arrive at the Richmond clinic. Scott's wife Zoe with their new puppy, Scully.
Hello.
Hey.
Hey, honey.
Okay.
Look who I brought to see you just because they love you.
Hello, monkey pants. What are you doing?
There may be just a tiny but quite significant chance that there is the other end of a dummy in her.
Great. It's just that sort of day. We're all feeling flat about Rosa, and suddenly Zoe walks in with our new puppy, Scully. No, it's not a social visit to cheer us up. Apparently, she swallowed a dummy, which is not the news I want to hear right now, and I hope this isn't going to turn out to be a serious problem.
I found two dummies like this, but I've only found one of these, and the only reason I found that is because she threw it up.
Right.
So she threw that one up this morning, and she has eaten and been sick again since, but no sign of the second one.
My team and I brought Scully into the world just recently. All right, babies, out you come. Okay, here's on baby catching duty, Ems.
I'm on.
It was a complicated birth, and it was touch and go for a while there. Any luck?
No, not yet.
But her brothers and sisters and her are all fighters.
Oh, I did hear a squeak. Squeaking!
After everything that we went through with how close we were to losing her, it is just so gutting that she's already back at the practice. All right, let me have a little feel. Unfortunately, I can feel what I believe to be this dummy. What we'll do is we'll do a quick x-ray with her conscious. We won't knock her out, and we'll see if we can see it on x-ray.
Yeah.
And then we're gonna have to work out what we're gonna have to do. I'm really worried for Scully. People might think that a dummy teat, it's soft, it should break down. But if it passes from her stomach into her small intestine, it could block. She could then get infection, she could get septicemia, and she could die. You are very naughty. Yes, you are. This is an incredibly dangerous predicament, and that dummy needs to come out. Can't be mad with you though, because you're so gorgeous. You're very naughty.
Here we go.
Baby, okay, so be ready just to take this shot once I've got her in position.
At the Richmond practice, Scott's dealing with a family emergency.
Ready?
X-ray.
With Nurse Nathan's help, he's urgently trying to find out if his new puppy Scully has swallowed part of a dummy.
Right, let's have a look. Zoe, jump in there. So, let's see if we do that.
That's quite compelling evidence, isn't it?
Yep. You fluffy doofus. So the x-ray is fairly clear as to where this missing teat is. The concern is how we're going to get it out. It's quite big, she's quite small, and at the moment we're quite worried as to whether she's going to bring it up or if I'm going to have to go in and get it. Let Uncle Nathan hold you.
Scott is desperately hoping to avoid surgery, so he's giving Scully an injection of apomorphine to make her vomit.
I know, I'm sorry, sweetie. Right.
How quickly is this going to work, Scotty?
Very quickly. Yeah, she'll start vomiting. Hey, just pull back your ears. Just think it's this or possible anesthetic and surgery.
Come on, sweetie, throw it out, please.
Good girl. That's it. Sorry, sweetheart.
Come on, baby. That's it. Go on. Throw it out, please. That's it. Go on. Go on. Come on. Anything?
The injection works. but there's no sign of the teat.
Come on, baby.
But on the second attempt...
Hey! Good puppy! Good puppy! Oh. Good puppy. Keep on being sick. Normally I would wear gloves for this, but with my fingers covered in our dog's sick, it must be love. Hey, must be love.
I've never been quite so excited to watch a dog vomit. And she's avoided surgery. It was like a trainer conversion all in one. But I would like her to not eat anything like that again.
Good puppy. Hey. It's an incredible relief and a weight off my shoulders that Scully's brought up this teat. It seems like a little thing. It's just a bit of plastic that a little puppy's vomited, but it means her daddy doesn't have to put her under the knife and perform surgery. So we're all very happy. No more dummies in the Miller household. No. All right? Poor baby. Hey, Tracy, how are you? Good to see you. Thank you very much.
It's time for Scott to check up on Tracy and his patient Domino. After surgery to remove the 15-year-old cat's troublesome thyroid gland.
Here he is.
Hello, handsome. How are you? Wow, Tracy's looking amazing.
He is, isn't he?
Yeah.
He's put on lots of weight.
Domino looks fantastic. He's much calmer. His coat looks better. He just looks great. A big sook, aren't you?
2 weeks after Domino's surgery, you could see a huge difference in him. He stopped crying for food and become a lot happier.
And are you finding that he's a little bit quieter as well? Because they're pretty vocal hyperthyroid cats.
Oh, he's much quieter. We can eat dinner in peace without him singing all the way through. Domino's always been an affectionate cat, but now he's even more so. For such an old cat, I think he's got a new lease of life. Where he'd stopped purring, you could tell he was unhappy, and now he purrs all the time.
Oh, isn't that great? So he's found actual happiness.
He has. Yeah. You can see he's a lovely, healthy cat now.
Tracy's been an incredibly brave owner. For any cat owner to put a cat that's as old as Domino through surgery is always fairly daunting, but we've got a fantastic result in this cat is now comfortable, he's happy, he's relaxed, and he's enjoying his company again with Tracy, so it's a fantastic result.
Take the doggies for a swim.
Yeah, is that lovely? Here we go. Here we go, Papa.
Scully's like, this
Good
is
girl,
very
Betty.
new.
What do you think?
As for mischievous little Scully, she's been on her best behaviour since the dummy ordeal.
It's a good girl.
And today, Scott and the family are enjoying some precious playtime together.
Daddy, can you...
It's like a wet mop head. You want to hold that? Yeah. She's made a huge impact on our lives. The kids absolutely love her. Betty adores her and she's got a new spring in her step. And I honestly can't see a life without her. What do you think, Scully? Any good?
For Scully's first go.
Not too bad, although Scully does turn out to be a drowned rat underneath all that.
It's a different start to the day for Scott. He's on his way out of London after an SOS from a very busy cat rescue centre in East Sussex.
Come on!
Liz Knight and her team of helpers run the Catastrophe Sanctuary, and currently they're looking after nearly 200 cats.
I think it's probably from my childhood, if ever a stray cat turned up, you didn't pick up the phone and get someone to come and remove it. You gave it food, you looked out for it, that was it. You just did something for the animal to save a life.
With the growing number of strays in the UK, it's a never-ending challenge.
I thought that with spaying and neutering, numbers were being controlled more, things would be improving. But the demand is just absolutely huge. The phone doesn't stop ringing. You could end up with 1,000, I think, quite easily.
Want to come and have your tea?
And now, Liz wants Scott's
That's
help
yours,
with a very
especially.
special case.
Come over here.
3-year-old Janet.
Seeing Janet for the first time, I could see there was a big problem with the mouth, with her coat, that she obviously couldn't clean herself properly.
Good girl, Janet.
She sticks her tongue out, and it's because she has a fused jaw. And I knew that this could be a real challenge. We might be able to help her, but it could go the other way. But whatever happened, we had to do the right thing for her, so she wasn't suffering.
When Scott arrives, even he's astounded at the size of the welcoming committee.
Wow, the first image of this house, straight away there's a cat that was looking out the window and then turn around the corner and there is just so many beautiful felines just waiting to greet me. Hello, everyone. Hello. This is cat heaven, isn't it?
Hi, Scott.
Hi, Liz.
Hello.
How are you?
Fine. Welcome to Catastrophes. And
I love it.
Sanctuary. Mwah.
This is a lot of cats.
Yes.
So it started off with just looking after a few and then
yes,
rescuing
it kind
a
of
few.
started with about one little young ginger cat that needed help. And then people get to know you, and then it just goes on from there.
Yeah. So you take the cats that no one else wants.
We tend to try to help cats that are perhaps more difficult to home. They're the ones that we try to help, the ones that have really got no chances left.
Hello there. So which one of these beautiful felines is Janet?
Right, that's Ron Turner. This is Janet.
Hello, Janet. Hello, gorgeous. Oh, I can see the tongue. I'm just going to have a fit. Wow, so that is it. That is literally as far as I can open it. Wow. Janet's a very lucky cat that she's found herself in the loving arms of Liz, but I can tell you what, this cat is still struggling. She can't open her mouth, so therefore she can't groom herself properly. She can't eat properly either, and within the mouth I can see some really rotten teeth. How can anyone do a dental on a cat where you can't open a mouth? And any ideas as to how that might have happened?
I don't know if you think she may have been born with this or if it's from a road traffic accident where she's taken quite a bad knock and it hasn't been dealt with at all.
Let's have a feel. So the mandible, the actual lower jaw, feels all right. It's just when you get back into the joint.
Oh, right.
And that's where they're simply just not opening enough for her to open a mouth.
And she tries to wash herself and keep herself clean, but she looks quite sort of mucky and discoloured around her front legs.
You do, sweetie, don't you? You're constantly drooling. Hey? Hey? Yeah, let's have a look at you. Hey? Oh, wait. Janet's case is a perplexing one. I don't think I've ever met a cat that you couldn't open its mouth. So I don't understand what's caused it, nor do I know if I can fix it.
She wants to live, but I think we've got to try and...
do something.
Yes, yeah.
Scott will now organise for a 3-dimensional scan to be taken of Janet to find out if anything can be done to fix the jaw.
I think the first step is CT scan. Let's understand what's on the scan.
Okay.
And then I would suggest that as long as you're quite brave,
absolutely,
then we may have to go through a surgery.
Yeah.
So.
No, if we can make her quality of life good, I think that's what it's all about.
So at the moment, I have just as much concern and trepidation about this journey as Liz does, but together we're going to do our best for Janet. It's going to be a long process. You ready for it?
Yeah.
Where's he gone? Where's it gone?
Later that week at Richmond, 8-month-old Ziggy is enjoying some playtime with owner Penny and her son Josh before they take the puppy into Scott's practice. The lively Norfolk Terrier came into their lives at a difficult time.
Josh, my youngest, had been asking for a dog forever. And I kept saying no and putting him off. And then, unfortunately, my husband had a dreadful accident. He was hit by a car while riding his bike and sustained extensive damage. And we just thought, life is so precious, let's just do it. And then we got Ziggy. We went to pick him up and he's this little ball of fluff. And he was so scared and you just wanted to hug him and protect him and make him feel okay. It was lovely.
You're tired, my little Popsy. Yes, you are.
My teenagers have asked me if he's my favourite child, and I had to say no, that you're all equal. But when they're naughty, yes, he is my favourite.
A very tough puppy, aren't you?
He is a tough dog.
But later today, protective mum Penny will hand Ziggy over to the vet for his first operation. It's time for the little terrier to be castrated.
This is the first time we're taking Ziggy to the vets for something serious. So yes, it is worrying. We'd be really lost without him.
You're my good boy. My good boy, aren't you? Hey, Ziggy Wiggy.
Hey, Steph.
Hi, Scott. How are you, mate?
Good to see you.
This morning, Scott's booked in for a trim with his longtime barber, Steph.
Yeah, really well, thanks. Hey, Bonnie.
Steph's little apprentice is 6-month-old Bonnie.
She's getting big, isn't she?
She's getting huge.
A poodle Bichon Frise cross, also known as a poochon.
What a lovely thing to bring a dog to work every day, hey?
Fantastic, yeah, she's my best friend. Bonnie is the most excitable dog I've ever seen.
Your daddy's girl. Oh, God, Bonnie, you're right there.
From the morning she wakes up, she's like she's never seen you before. She's so happy.
Oh, Bonnie, honestly, are you this bored with all of Daddy's clients?
Everyone loves her. She's a little showstopper.
I still can't believe, Steph, I gave you so much stick for getting a white fluffy dog, and guess what I've got now?
Pot kettle.
Yeah, totally.
Good girl. Sit, Bon. Sit.
But lately, Steph has noticed some problems with his little princess.
After Bonnie's walks in the morning, she's a little bit stiff.
Right.
Not limping, but just a little bit stiff afterwards.
So that's a bit strange. Has that been going on for a little while?
Probably about 3 months now.
Oh, okay.
I mean, she's fine to run, but just afterwards, she's just not herself.
Okay. Yeah, that's not normal. Certainly not normal. For a young dog, it's not normal at all. Bonnie's a toy poodle, and they are quite fine bones little dogs, and they can be prone to not only injury but also developmental conditions that can affect really young dogs, even as young as Bonnie. Come on then, sweetheart. Let's have a little look at you. Hey? See what's up with your legs.
From what I can gather, it's her left leg, maybe her hip or her knee. I just hope it's nothing too serious.
Oh, yeah. You're not impressed by that, are you?
I don't really like her being in that much pain or kind of wincing. What do you think, Scott?
Well, she's definitely uncomfortable with me extending that hip, and that shouldn't be the case. She should be nice and supple and flexible, and she does seem a little sore, so we do need to look at that. The fact that she is pulling up lame and sore, that is a problem, and it's certainly concerning Steph, and so I absolutely need to look into that for him. I think if we give her a sedation, I think that's the best way to really understand what's going on, because I can feel it without her reacting in pain, but also I'll be able to perform an X-ray.
Okay.
I've been to your place of work today, so I think I'm going to have to invite you and Bonnie to mine.
I'm happy she's getting X-rays. I want to get to the bottom of what's wrong with her. But I'm a little bit worried about the sedation. Anything can happen, you know?
Okay. Right. Off to the clinic we go. Hey, Bon? Yeah? Hey, Kirsty. Can I introduce Steph?
Hello.
And this is
Lovely
Bonnie.
to meet you. Hi, Bonnie.
At the Richmond Hill practice, Scott and his barber Steph have arrived with 6-month-old Bonnie for X-rays of her back left leg.
Steph's noticed that Bonnie's been a little stiff after her morning walks. Come on, sweetheart, say goodbye to Daddy. It's been going on for quite a while now, so he is getting a little bit worried that maybe it's something more serious, and it's just something that he wants me to check out.
Bye, Scott. Bye, Bonnie.
Brave girl, brave sausage.
Scott and nurse Nathan are sedating Bonnie so they can conduct a full examination of her hips.
Probably not quite as stylish as Daddy would do it, hey, but it does the job.
Scott's obviously the best person. I feel really comfortable with him and safe with him, and I trust him with Bonnie, definitely.
So can you feel anything?
It's just this hip. I think we're going to do a few X-rays on and just understand exactly what is or isn't going on. Hopefully nothing too serious. Come on, sweetheart. Good girl. The main things I'm looking for with little Bonnie is to see if there's any degenerative conditions like leg calf Perthes disease, which causes their hip joint to break down. Other options could be issues with the knee, cruciate ligament injuries, or even possibly a dislocating kneecap. X-ray. So we have to be very careful that we don't miss things, because if we stand back and wait, things can get really bad really quickly.
After a long look at the X-rays,
looks like there's one,
Scott can now give Steph his diagnosis.
Hey, Steph. Hey, yeah. Come on down.
Is she okay?
Yeah, she's all right. Come and have a look.
When you're waiting, you're always going to think of the worst.
Shall we?
Yeah, how is she? It was a bit of a horrible wait.
She's just recovering from her sedation.
I wanted to give her a little kiss to make sure she is okay, she's not moving. And she looked like she had small tears in her eyes, which was quite sad to see. All I wanted to do was just make sure she was okay.
So, worried dad, the news is good.
Tell me.
Her hip looks fine. So I think it might just be that she is very excitable at work. She loves jumping on those really high chairs. She's extending her hips pretty much all the time, every day. And it's just a little bit too much for her little frame. So what we need to do is to train her to sit and to stay on her bed and have people come to her, not she go to them. You, my friend, need to do a bit more training.
That sounds like a deal.
Yeah? How you feeling? You all right?
Yeah, really happy, thank you, yeah.
There you are.
Good girl.
Did you hear Daddy's voice?
She looks like she's got a hangover.
Yeah, how you look on a Sunday morning.
Good girl, Bonnie. I'm so relieved she's okay. She's gonna get home, get lots of treats and cuddles, and maybe go to bed for a few hours and have a little relax.
Oh, I'm glad everything went well.
Thank you very much.
Oh, lovely to see you.
Thank you.
Oh, take care. Bye.
Are you wagging? You getting excited?
At a nearby cafe, one of Scott's full-time vets, Joe, has brought along her dog Kimber to meet an old friend.
Hey. It's Neil.
Hey, how are you? Good to see you.
Joe and Neil first got to know each other studying veterinary science at university.
Nice to see you.
How's your travels been?
Yeah, they've been amazing.
But while Joe stayed in London, Neil's been travelling the world, working as a vet.
So as a locum, I am constantly in and out of new places. You work with different people, you see different ways of doing things.
Scott's in need of an extra pair of hands this week, and Neil's the perfect solution.
What's Scott like to work with?
I think you'll get on fine with Scott. You're very laid back, and I think that will work well.
It's always a little bit nerve-wracking coming into a new place, coming into a new team. You're wondering, whether you're going to fit in or, what the people are going to be like there.
Come on, Kimmy.
Come and see me. Hello, gorgeous. You must be Neil.
Yes, hi, nice to meet you.
And
Good
nice to meet you as well.
finally.
Yeah. Well, we've got a very, very busy week planned, so I hope you're ready.
Yeah, I'm ready.
So we need to throw you straight into scrubs and get you going.
Great, let's go.
All right, come on then, Kimmy. Let's show him the ropes.
Have fun.
While Neil settles in,
You're gonna be fine, my lovely.
his first patient of the day is already arriving. Norfolk Terrier, Ziggy.
How are you? Doing well.
Ziggy.
Hey, Ziggy.
Oh, is it Ziggy's big day today?
Yes.
The 8-month-old pup has come in for a castration. It might be a routine operation, but Penny and her son Josh are still feeling very nervous.
Come on, Ziggy. I don't think Ziggy knows what's about to happen because he likes coming to the vets. He thinks it's a friendly place. He won't feel so happy when I pick him up. I think he'll be very sad.
Ziggy?
Yes.
Hello, Ziggy, how are you? Did you want to come through? We'll have a check over him.
Yes.
Okay.
Come on, Ziggy. Come on, my lovely.
So he's coming for castration today.
Yes,
Yeah,
my poor
scary
thing.
operation, isn't it?
I know, he's
Very
a bit
handsome.
nervous. He's
Yeah,
shaking
he's a
a
little
little
bit
bit,
nervous.
isn't he?
Is he normally a nervous patient?
He's hopeless.
Yeah. Okay, so let's give him a quick check over before we admit him. Okay, lovely teeth there. Have a quick check of his
It's
chest.
all right, my lovely. You're going to be okay. Yes, you are.
Okay.
Yes, you
Nice
are.
strong heartbeat there. Have a quick feel of his abdomen.
Oh, there you go, Ziggy.
Oh, so I've just felt a little hernia there, actually.
No.
Yeah, so essentially it's where his belly button is. Where
Oh, Ziggy, my baby.
normally that's where all the blood vessels come out
Yeah.
and attach to their mother when they're in the womb.
Yeah.
And in the majority of cases that'll fuse up straight after they're born. But in his case, I don't think that's fused up 100%.
Oh, is it a problem for him? Is it
Potentially it could be. So that hernia could potentially open up, get a little bit bigger, and that facilitates his abdominal contents to slip out, which would be life-threatening.
Oh no, we don't want that, my love. We don't want that, do we? That's not a good idea.
To avoid more surgery in future, Neil will repair the hernia today, straight after the castration.
Oh, you look after him for me.
We will do.
He's so special. I feel rotten because he doesn't know what's coming.
We'll take good care of him.
Yeah.
Okay?
But I think this is for the best.
He likes that cuddle, doesn't he?
Yeah.
Okay, Janet, here we are, Uncle Scott's.
Liz from the Catastrophes Cat Sanctuary has now arrived at the Richmond practice with one of her very sad cases, Janet.
Did you want to have a seat, Liz?
Yes.
Got me right with you.
Okay, thank you.
The young rescue cat has a fused jaw, causing major problems with eating and grooming.
Good girl, Janet.
CT scans have already been carried out, and Liz is about to find out whether anything can be done to fix the fused jaw.
This is kind of the crucial stage, really. I mustn't get emotional now because we've got to have a sensible conversation with Scott and go from there. But she means a huge amount to all of us, yeah. She's wheedled her way into our hearts.
Do you want to see the 3D reconstruction?
Oh yes, look at that.
Meanwhile, Scott is reviewing Janet's CT scans with specialist oral surgeon Aurora Mateo.
It's brilliant to have this level of experience because it is a major thing we're going to have to do on Janet today.
Both hinges were broken and healed in wrong position.
So basically her jaw at the moment is hitting her eye socket.
Yeah.
Wow.
Scott and Aurora will need to perform drastic surgery and may have to remove both the hinges, also known as condyles, from Janet's jaw. It's her only hope for a normal life.
Something must have happened long ago, some kind of trauma, because both condyles are broken and fused in a wrong position. Now her teeth are also infected and she's in pain now.
So we remove a rusty hinge from her jaw. We hopefully see it open a little bit better. We clean her teeth and we give her a good life.
Exactly. Good plan. It's going to be a hard surgery. I want to do it for her. I feel good that I'm here, but it's going to be a challenge.
So you get prepped for surgery.
All right.
And I'll go and grab the lady of the hour.
Okay.
All right, one sec. Hello, Liz.
Hello.
How are you, gorgeous?
I'm okay. How are you?
I'm really well. Hello, Janet. It's your big day today, isn't it? How are you? Hello, gorgeous. Come on, then. Come and see Uncle Scott. That's a good girl. Right, so it's a hell of a CT scan. It really is. But what we think is that years ago, she suffered quite a significant trauma, which meant that she had fractures on both sides of her jaw.
Crikey. Yeah.
And the body's tried to fix itself, but just not done a very good job. So what we're going to try and do today is to just remove the hinge completely. The muscles and the ligaments and everything around the jaw will do the work of the hinge joint, but the hinge is not helping, so we need to get rid of it. I'm quite nervous about this procedure because I know it's going to be a long and very tricky process, so we just need to work step by step and hope for the best. Give her a big kiss of good luck.
Brave girl. Mummy's with you. Mummy loves you. You've got lipstick on you now, darling, haven't you? There, good girl, good girl. I'll see you soon. Everybody loves you.
Okay, so this is little Ziggy. So he's a bit of a nervous puppy, so you have to be a brave little guy, hey?
At the Richmond Hill practice, locum vet Neil and nurse Nathan are preparing 8-month-old Ziggy for his castration and the repair of his hernia.
It's fairly routine, but, you know, it's not the nicest operation. So, you know, we'll take care of him, give him lots of love, lots of fuss. So let's start clipping him up. Make sure you've got the right end. He looks the same from head to toe. So we don't want to take his tonsils out, do we?
Today's operation is their first surgery together, and a bit of vet humour is breaking the ice.
Bit of manscaping there.
Yeah. It's one of those procedures that kind of lends itself to joking around. Nice, neat job, Nathan. Look at that much hair. You can make another dog out of that. And it just makes the whole experience a little bit less routine. Right then, let's get started. A little bit eye-watering for most people, I think.
Better out than in.
Absolutely. It's a nice, quick procedure. Obviously, we recommend that every dog has this done, unless you're going to breed from them. There's too many puppies in the world that aren't loved.
But that's not the case for this puppy.
You'll be all right, madam. She has no idea.
Owners Penny and Josh have already returned to the clinic and are waiting for news.
I've just been really nervous about him because he's just amazing and I really don't want anything to go wrong.
How's Ziggy doing?
Yeah, doing well.
Yeah?
Doing well, yeah.
Good, glad to hear that. Okay, so we're going to move on to the hernia now. So we're going to make a small incision and then pop everything back in, stitch it up. Hopefully we'll save him from having to have any further surgery in the future.
I think Ziggy will sulk for a few days. That's what he usually does, and gives you the look, as if to say, what have you done to me?
Okay, little guy, you going to wake up for us? So Penny's obviously really attached to Ziggy. I'm sure she's missed him terribly while he's been with us, so I just can't wait to reunite them. Here he is.
Ziggy! Oh, my precious.
Been looking forward to seeing you again.
How are you, my
He's a little bit
lovely?
sleepy.
I'm just so relieved to see him, but he just looks so sad. You just want to take him home and wrap him up and look after him. Yeah,
Okay.
thank you so much.
No
Let's
worries
take
at
you
all.
home, Ziggy.
When you see an owner like Penny and the love that she has for her dog Ziggy, that's what makes it all worthwhile.
Come on, my lovely.
So, Aurora, this is your patient. This is Janet. And Nathan, if you just hold around the shoulders, let's just have a quick look at this mouth, and you can see that's about the limit of being able to open it.
At Richmond, oral surgeon Aurora Mateo is getting her first look at Janet's fused jaw.
Really, really disgusting teeth. Really sore gums.
Nathan and Sam will be assisting with the surgery on the rescue cat.
Also, we can see that alignment issue there. You can see those two canines butting up against each other, can't you? It's pretty shocking. This cat has struggled for a very long time with a mouth that she can barely open. She has teeth that lock together, and also her tongue is very swollen, very sore because of years of hanging out, and that also is causing problems for her. We're going to sort you out. Yes, we are.
But before they can start work on Janet's jaw, Scott needs to get a breathing tube into the cat's mouth.
God, just getting in there. Gosh, I can't see a thing. I might have to try and go blind and just see if I can get it. She's got a very thickened tongue, so that's almost making a speed bump. So trying to put a tube down there makes it one of the most difficult intubation processes that I've ever had to face. God, that's ridiculous.
Did you pack the vaccine?
Yep, I've got everything we need.
For Joe and nurse Gemma, things are a lot less stressful. They're taking a break from the clinic to help out at a local school with some unusual classmates.
I'm looking forward to seeing them. Today's really exciting because the school has this amazing ground where they've got bunnies, guinea pigs, and they've even got a horse. So it's great. Can't wait to go and see them.
Hey, kids.
Woo!
Joe's been looking after the animals in the school's farmyard program for the past year.
So does he get to run around your playground, I hear?
Yeah, when everyone's gone.
So growing up in London myself, I know that you don't get that much exposure to farm animals when you're young.
Does he go on the slide?
No.
No, he's not allowed on the slide.
So it's great that these kids have such a variety of farm pets to learn from. They've been taught how to handle them, and they're so confident around them. You can just tell that they love having these pets. Well, Spot's looking good, but we're here to see the goats today.
So shall we round up Jack and Jill?
Yeah, who's going to go and get Jack and who's going to get Jill? Go on then.
Today, it's the turn of the pygmy goats Jack and Jill to have a checkup and vaccination.
I like going to school because they're fun and exciting.
They don't look keen to have their vaccine.
It was great fun today watching the kids trying to round up the goats. They were running around crazily, but within minutes they had them under their command. It was brilliant.
Hey, well done, guys.
Recently, the school kids raised hundreds of pounds to pay for Jack's emergency surgery to remove the goat's life-threatening bladder stones.
Did you miss him?
Yeah.
Yeah. Oh, well, it's good that he's better
And
now.
even Jill missed him.
Did she? Oh, that's nice.
He's a wriggle bum, isn't he?
Right,
Are
let's
you
have a
wriggling?
listen, Jack.
Before the vaccination, Joe's giving the recently recovered Jack a complete health check.
I heard a big burp.
Yes, he just burped. Did anyone else hear that? Yeah.
Right, who wants to listen?
Everyone, probably.
They're all good at putting up their hands. You hear it?
Did you just burp in my face?
You heard a burp, great.
So the kids were finding it really funny that the goats were burping and farting today. I mean, kids love talking about burping and farting anyway. Who doesn't?
Hear anything? Yeah? Great.
Oh, pardon you. But in all seriousness, goats do need to release the pressure from their stomachs, otherwise they can become quite seriously ill.
You hear it?
Oh, yes, I do.
Yeah? We like goats burping, that's healthy.
So, Jack's been given the all clear and can now be given his vaccination.
We'll just put it under the skin. We'll just give it a rub. Make sure he doesn't feel it. Oh, he's so brave.
Well done!
Should we get Jill? Do you want to know?
Come on, Jill.
Jill, however, is not being so cooperative.
Come on. Jill, come on, Jill. I know,
Hey, it's
I
not
know.
so
I know.
bad.
I'm sorry, darling. I'm sorry.
Okay, now she's happy. Let's have a listen to her.
Oh, you burping too? I didn't know goats burped so much.
Hi, Jill.
Good girl.
Very good.
Yay! Well done, Jill.
Done.
There you go. Off you go.
Oh, she's off. She's off.
She's off. She's going crazy. I don't think she liked it.
Well, thanks for helping us. You guys were really great. And I guess we'll be back in 6 months.
And you're going to look after them till then for us?
Yeah.
You're doing a very good job. Bye, Jack.
Yeah.
Yes.
So today went really well. The kids, I think, learnt a little bit more about their goats and they were really interested. Who's following you, Jim?
You coming home with
Coming
me?
out.
Come on then. You coming home
You
with me?
can't have a pygmy goat, Jim.
I want to pygmy goat, but he's coming home with me. Can I take him? Come on, Jack. Jack. No. He's more interested in the grass.
After all.
Yeah.
There's virtually no movement in this jaw, so it's just about
That's not easy.
getting the access.
That's not going to fit.
Back in the Richmond operating theatre, Scott is struggling to put a breathing tube into rescue cat Janet's mouth.
Yeah, that's literally as open as we can get it. Goodness me.
But at last, there's a breakthrough.
That's in.
Yes! Get in!
Okay.
All right, okay, onto the gas.
Surgeon Aurora can now start work on removing Janet's misaligned teeth.
So let's go for it.
But surgery is barely underway when Scott has more problems.
I can't see a thing.
Janet is just not getting enough oxygen through the breathing tube.
So unfortunately, what's happened here is that the tube going down into Janet's throat has shifted and she's got so much saliva in the back of her throat we can't actually see. So what we need to do is perform what's called a tracheostomy, basically placing a hole through her windpipe and then down into her chest, which will allow her to breathe and also for us to maintain her anaesthetic. Let's get some oxygen in this cat. It's become an emergency situation. This cat is in danger and we need to do something fast. Can that light be on this angle coming down? We're just concerned that her anaesthetic isn't deep enough, otherwise she wouldn't keep waking up.
At Richmond, Scott and specialist oral surgeon Aurora Mateo are attempting to unlock Janet's jaw. But with the breathing tube failing to give Janet enough oxygen, they are now about to carry out an emergency procedure.
Once I realised that the tube isn't in and my patient is slowly turning blue, which is showing that she's not getting enough oxygen into her system. And that means we have to perform an emergency procedure, which is called a tracheostomy, placing a hole from the outside of her neck into the windpipe to place the tube, something that we rarely have to do as vets and something that is quite risky.
Okay, there we go.
Yes. Okay. Support that the whole time, Sam. Don't let that tube go, okay? So now, thankfully, we're in a position where we have an established airway, which wasn't the case before, which is very nerve-wracking indeed. But now we have a tube down her throat, done this way rather than down her mouth. But actually, that's allowing us to have a look at the mouth so much easier. And now we're actually going to remove the left canine. Aurora starts the procedure by trying to remove the teeth that seem to be locking or touching each other and causing the inability of Janet to open and close her mouth. We start removing one after another, after another, after another.
Another healthy tooth.
Yeah. Shame it has to come out, but it does. So that one needs to go as well. This really is a marathon. In all, we have to remove 4 teeth, the ones that were contacting each other and stopping Janet's jaw from closing. But now we have to try and help open it a bit more, which means tackling the fused hinges on either side of her jaw.
See, the joint is right here.
Yep.
So we're gonna go for it.
The procedure to remove the jaw joint is called a condylectomy. Scott and Aurora are hoping removing the hinge to the jaw on the one side will be enough to free the jaw up.
Come on, baby.
But like everything with Janet's surgery, it's proving to be a real challenge.
The system, I can't get it out. Yes.
No more hinge. Well, on the right-hand side anyway.
Move it now.
Let's try now.
And it doesn't really help.
We've done quite a lot of stuff with this cat and still she is confounding us because we really hoped we'd be able to open more there and we just simply can't.
With Janet's jaw still not opening enough, the hinge on the left side will now have to be removed as well.
Yeah, so that's the second condyle, so the hinge joint on the left-hand side, now removed.
At last, the team are starting to get results.
I am happy we can close her mouth more. That's good. And she can open her mouth much more. That's good. But not as much. Yeah, that's enough. That's enough. We were complaining too much. It's enough. Yeah.
You are complaining too much. I think you've done very well. It's been an absolute Herculean effort by everyone involved today to get Janet through the surgery. But poor Janet, bless her, 4 hours of major surgery and certainly not very pretty surgery either. But she's come through it. The mouth is moving much more freely. It's certainly far from normal, but it's opening about twice as much as it did at the start of the surgery. Okay, and we're done.
It has been a very difficult surgery, long, and I'm knackered. Scott taught me that word. I'm really tired.
We've definitely made some inroads, wouldn't you say? But hopefully it's the start of a new life, eh? Although the surgery is over, Janet's work is still yet to really start. We need to do a huge amount of physio on this poor girl. That was a long one, wasn't it? Getting her to use this new jaw, get her to start flexing her muscles a little bit more, allowing for more flexibility in those joints, and getting her mouth open again. You deserve your bed tonight.
Janet will need to rest up and recover from the major surgery before she can be reunited with her carer Liz.
It's been a really lovely thing to be part of helping Janet. It's been very stressful at times, and poor Janet's been through hell and back. But we're really hopeful that this poor cat can finally live a comfortable life where she can have her tongue in her mouth, she can swallow and chew and just open her mouth normally like a normal cat. Let's hope. There you go. All right. Good girl. You're so brave.
Not really a puppy anymore, are you?
A week after his castration, Ziggy has made a complete recovery, although he's still lapping up the attention.
You're pretty chilled out now, aren't you, Ziggy?
It's far more of a case of man flu with Ziggy, you know. The whole world came to an end and he just needed constant attention and nursing on the sofa.
Come on.
I was feeling very guilty about him having the operation, but actually now he's doing really great and he's forgiven us and he's already sort of blanked it out of his memory, really.
Sit.
And after all that spoiling, Soft Touch Penny is trying to introduce some discipline.
How do you do, Ziggy? How do you do? Good boy.
Ziggy got away with murder, I think it's fair to say, while he was recovering, and now he's back in training. We're making good progress.
Oh, good boy, good boy, good boy. Good boy, good boy. Clever little thing, aren't you?
Okay, guys, I'm off.
Ah, Neil. Well, thanks so much for coming, mate.
No worries.
It's an absolute pleasure having you.
Yeah.
Meanwhile, Ziggy's surgeon Neil has finished his week as Scott's locum, and he's off on his next adventure.
Yeah, back to Australia now.
Nice. How's your kangaroo medicine?
Oh, I have to brush up on that a little bit, I think.
Really? Because you know we keep them as pets, don't you?
Well, yeah.
Everyone has a koala in their tree.
Yeah, I know.
And a possum in their pocket.
I'll try not to. I'm really sad that it's my last day. I've really enjoyed working here. The team are really friendly, the clients are really nice, and you know, obviously the pets are really cute.
All the best. Travel safe.
Take care.
Bye.
So hopefully I'll be back in the future. Who knows?
I didn't tell him about the crocodiles.
Work out.
Hey, hi, Janet.
How are you?
She's doing very well.
Yeah?
Yeah, eating biscuits this morning.
No way.
Yeah.
You're eating biscuits. What a clever girl.
Janet has bounced back from her marathon jaw surgery to the delight of Scott and Nurse Jess.
Listen to you purring away.
I'm very happy.
Janet has made a miraculous recovery. This cat is so brave and just so amazing. That surgery, in fairness, it was brutal.
Can we go home and see all those other cats? All 200 of them. Hey?
Janet's tongue is very obvious. It has changed in its anatomy. It's much thicker at the back. It's a little bit irritated at the front. But I'm hopeful that once she starts to be able to close her mouth, her tongue will go where it's supposed to be, which is back in there.
It's great news for Janet's carer Liz.
So here's Janet from another planet.
She can finally take Janet home to her rescue cat sanctuary.
Do you even recognise your mother?
You feel straight away she's purring. I think it's amazing that you've got over 200 cats, and she definitely recognises you.
I think she does, doesn't she?
She does, for sure. Yeah.
But Janet's rehabilitation is going to require some tough love.
So I hope your relationship isn't going to suffer with what I'm going to have to show you now, which is the physio.
Okay.
All right. This will definitely be a two-person job.
Yes.
So Jess, as you can see, is holding from the back there, and then the person at the front, all you want to do is just open and close this mouth. So relatively gently at the start, and then just a little bit of pressure once you get to the full open point.
Okay.
And then closing. So pop the tongue back in and then close the mouth. All right. And then just a little bit of a nice face massage.
Right.
You know, around those jaw muscles, and just breaking down any attachments and just basically giving her a bit of fuss and love. Hey, baby. Hey. Yes. Well, my little inspiration, it's time for you to get back to all those feline mates of yours. Hey? All right. Hey, let's send you back to the sanctuary. Good girl. Mwah. Oh, you've been so amazingly brave. Incredible.
I'm so pleased to be taking her home. I mean, I really didn't quite know how things were going to go. It was such a big step to go for this surgery, a huge step. I'm so excited that she's had all of this done, and it's fingers crossed. Now we've got to give her all the aftercare that Scott has advised. So I'm very excited and very, very pleased. Really appreciate everything that Scott and all of his team have done for Janet.
All right then, Liz. It's been an absolute pleasure and a privilege to do this, and I really hope that she continues to get better, and that I'll be able to come back and see her in all her glory soon.
Oh, that would be wonderful.
Yeah. All right, take care.
Great, thank you so much.
My pleasure.
Thank you hugely.
All right, bye, Janet.
Bye, Janet.
Be a good girl.
Bye, Jess.
Bye, take care.
Thank you.
Be brave.
When we get Janet home, she's going to have a welcoming party, but nothing to make her too excited. No fireworks. I'll just have some balloons. Everyone will be really pleased to see her, give her a kiss and a cuddle. It's good girls.
As for Bonnie, Steph's still allowing her to visit the barber shop every day. But there's no more jumping on clients' laps.
Scott helped us put boundaries in with regard to jumping up, jumping on people, jumping on chairs, sofas. I definitely think it's helped Bonnie's hips, and there seems to be no more lameness. I suppose it's similar with children, you know? You want to let them do what they want, but it's not really the right thing to do. So yeah, she needs boundaries. Sit. Good girl, in your bed.
And there'll soon be another big adjustment for Bonnie.
My girlfriend's pregnant, so our baby's due fairly soon, which is amazing, and he's going to be the little one in the family. Good girl, Bon. Good girl. I think Bonnie's going to be great. She might have to get used to it a little bit, but I think she's going to be just fine. Good girl.
And 4 weeks later, Scott drops in on a very special patient to find out whether a very harrowing surgery has paid off.
Hello.
How are you, gorgeous? You well?
Come through.
Thank you. Today I'm back to see Liz at the cat sanctuary to check out Janet and just see how she's going after that mammoth jaw surgery.
It's the welcoming party.
Yes, very welcoming. Hello, beautiful. So Janet's in here?
Yes, this is the inner sanctuary.
Wow, Janet's got her own room now.
Yes, it's supposed to be a cat-free zone. But,
well, that's not working out very well,
no,
is it?
it's not working. And here's Janet.
Hello, beautiful. Hello, gorgeous. How are you? How's she been going?
Really amazingly good. I mean, fantastic, yeah.
Really?
Astounding.
She looks amazing. I mean, one of the biggest things I can notice straight away is that her tongue is now living pretty much in her mouth,
Yes.
which is nice.
And actually, it is usually more so than it is at the moment. And she's such a happy little thing, very bright, very, sort of, you know, charging around. And she's actually biffing some of the other cats, like having little kangaroo
Getting a bit of
fights
spirit
and
back.
Playful and
Good.
really bright. Janet's been a really good patient, actually, surprisingly. I thought she might be a bit of a handful. But no, she's been really good. She actually seemed to even enjoy the physio, really.
So from the physio and everything else, she's actually now like eating proper food, is she?
Yes, she is, yes. And she's washing herself, grooming.
Wow.
Just really active as well.
She just is the picture of how she looks so beautiful, and I can hear that purr from a mile away. Yeah, she looks beautiful. Oh, you're going to give me a nibble. Never have I wanted to be bitten by a cat more.
No, I know, this is it, isn't it? You can't really complain. You just think, oh, that's good, that's good.
I'm going to say it's a love bite. That's what I'm going to say. Oh, yeah. It's always difficult when you do a major surgery like this to a cat that's been that way for a while. But now I can very happily say we've been successful. This is now a healthy, comfortable, happy cat who has a functional jaw. It's an amazing result.
Oh, we've got Rosie joining us.
Oh, look, she's even biting Rosie. Oh, look.
Come along, she says, do get out of it. This is my time.
And now, on reflection, a worthy
I'm so
journey.
pleased, absolutely, definitely.
Oh,
yeah,
so
no,
good. I'm really happy for
really
you.
Thrilled.
Really happy for you,
Yeah,
really happy
fantastic.
for her. And I'm sure we'll go on that journey with another cat at some point in the future.
We'll have a little queue for me.
An orderly queue of over 200.
Yes.
Why don't we have a race? Everybody grab your own guinea pig, get a piece of spinach each, right? And we'll see who's the fastest spinach eater in the West here, okay?
In Richmond, just across the road from Scott's practice, sisters Ruby, Olivia and Jasmine, plus dad Kevin, are enjoying time with their much-loved guinea pigs.
I think the spinach is better than the corn.
Ruby was given 2-year-old Maple as a birthday present, but recently there's been a huge lump growing on her guinea pig's body.
I'm quite scared. I love Maple so much. She's just wonderful. I didn't really think that guinea pigs would be like a nice animal because I thought that they were like rough and hairy, but they're actually really soft and really nice and cute.
The three amigos are ready, eh? Okay, shall we go?
So all the girls and dad are heading over to the practice to find out just what Scott will recommend.
Ruby's a tough character. She loves Maple, and she'll take the good with the bad. Obviously, we'd like to see the good more than the bad, but I think she's prepared for it. if it's not good.
Hello, girls. Lots and lots of girls all together in a pink bag. So it's very suitable, isn't it? Maple's yours, isn't she, Ruby? All right. Well, I'll grab beautiful Maple. So you two follow me. You two grab a seat. All right, we'll go and have a chat.
Radio.
I absolutely adore the family. They're so wonderful. And it's always great to see them. Unfortunately, this time around, it's under relatively sad circumstances. All right, well, let's have a look at your beautiful girl. She's got those incredible albino eyes, isn't she? Ruby red eyes for a ruby red mum. But straight away I can feel that lump. Have you seen that growing?
Yeah.
And quite quickly, hey? Yeah. And if you think of how big that is versus how big your guinea pig is, you know, if you then turned that into me, I'd probably be like a rugby ball size on my body. How are you feeling about all of that?
I'm really worried.
I think it's the right thing to remove this, because if it gets any bigger, I won't be able to close it back together again. It's almost like dressmaking, really. When you take a section of material away, you need to be able to close it, otherwise you can't wear the dress.
Scott's so worried about the aggressive growth of the lump that he's booking Maple in for surgery later today.
This lump has grown quite large in a short space of time. And when that happens in animals, that's a red flag, that's a concern. It could be cancer.
Also heading to the Richmond practice is Texan-born Molly and another American import, Smitty.
Hey, Scott.
Morning, Molly. Morning, Smitty. Jump
In a
on the
few
scales
weeks,
there.
Molly is planning to fly home to the States for Christmas, but she's worried the trip may have to be postponed because Smitty's having trouble with one of his back legs.
Hey, did I spy him skipping
You did.
on the way in?
You did. It's getting worse. The first time I noticed something was really wrong, I was at the park with Smitty, and all of a sudden he was limping on his back right leg.
First of all, I'd like to just see him have a little walk, if that's okay.
Come on.
Yeah, he's really holding his leg out, Molly.
Yeah. It's clear that Smitty's knee is getting worse, and that is a really hard thought because I just hate the idea of having him feel pain.
All right, little man, let's have a look at you. Hello, buddy. Hello, sweetheart. You okay? Hey, he is such a good boy. He's always such a good little dog.
A real sweetheart.
Now, what I'm going to do now is just have a little feel of this knee and just see if we can see the, yeah, look, you can see that knee popping in and then, boop.
Yeah.
Pops in and it pops out. And it's actually now living out of the groove more often than it's living in.
Right.
It is not even trying to stay where it's supposed to stay.
Okay.
So that's why that you've seen the progression of the clinical signs, the skipping. We'll see more rubbing, we'll see more arthritic change, and those things I can't reverse. But what we can do right now, if you're feeling brave, is actually perform a surgery so that the kneecap no longer pops out.
Okay.
And that we stop the progression of the arthritis here. If we didn't perform surgery on Smitty, he would slowly but surely develop more and more arthritis in that joint. It would become more painful, it would seize up, and eventually he may not even be able to use the leg.
I know it needs to be done. I hate to put him through it just because I don't see visible pain, but I do see that it's getting worse. So I'm ready to do it. Oh, little guy. It's okay, little buddy.
Molly's obviously apprehensive at putting poor little Smitty through surgery. Fair enough, it's a big procedure we're going to have to do, but it has really important long-term benefits. And I think it's a case of a short-term pain for a long-term gain. Okay, champ, you're coming with me now, my friend. That's a good boy.
Oh.
I know, you're going to miss your mummy, aren't you? All right.
Bye, buddy.
Say bye, mummy.
Bye, Smitty.
Say see ya. No more skipping for you.
Bye, Smitter.
Come on, Maple. Here's the birthday boy.
Oh, excellent. So you got me a birthday present then?
Yeah, guinea pig. How you feel, mate? Happy birthday.
It's Nurse Nathan's special
So,
day,
there's the lump
but
we've
it's
got to
also
remove.
a big occasion for Maple.
It's a fairly substantial mass.
Scott's about to remove a suspicious-looking lump from the little guinea pig.
And it's growing quite quickly and in quite a short space of time, and that's what worries me massively. But for now, we just need to do one step at a time. So first thing is anesthetic. So I'll give you a little bit of gas, gorgeous, okay? And get this nasty lump off you. Yeah? Good girl. All right. While she's going down, I think we'll just put on the obligatory guinea pig booties. What do you reckon?
Definitely a little bit of space booting.
So what I'm doing right now is just insulating little Maple's feet. Guinea pigs have a really fast metabolic rate, and that means that they lose heat very easily as well. So what we're doing is putting on these little, well, bubble shoes, we'll call them, and it just helps to avoid her losing as much temperature as possible from her feet. Right, there we go. So footwear done. Okay, and now for the main event.
As soon as Scott shaves the area, the full size of the lump is revealed.
Okay, well, that unmasked is more horrifying, really, isn't it? I mean, it's huge. Definitely get that off you, sweetheart. I don't like the look of that at all. I told Ruby that this surgery was going to be difficult. This lump really is massive, even bigger than I thought it was going to be once all the hair's been removed, and it's going to prove more of a challenge. So now it's about taking enough of the lump and the surrounding tissue away that it's a curative result, so that we've removed everything we need to, but still being able to close it. And that's the tricky bit. Very, very tightly adhered to underlying musculature. It really is absolutely huge. Absolutely huge.
The massive lump will immediately be sent off for testing.
But now the real hard work begins. We've got to close that huge hole in this tiny little guinea pig. And because this lump was so big, I've got a big deficit that I need to fill. Worst case scenario, if I can't close this wound, poor little Maple will have to live with an open wound. And that's not great when you're dealing with a guinea pig. Anyone knows a guinea pig, they're quite dirty little creatures, and that can be quite difficult to look after. Okay, I've managed to touch the two sides together, which means that once I put the sutures in place, hopefully there won't be too much tension and it'll heal. Okay, and that is that. You wake up. Here she comes. Here we go. Hello, baby girl. It was a quick wake up, wasn't it? Hey, you want to get back home to mummy? Hmm? Yeah. Girl. Hi, guys.
Soon after, Scott delivers Maple back to her family, waiting patiently upstairs.
So there's where I had to take it away. At least it's out and it's together.
Yeah, fantastic.
So it would look a lot worse if we couldn't close it, but we've been able to, so that's
fantastic.
good. Now you need to make sure you give her lots of love and cuddles tonight. Do you think you can all do that? Yeah?
Thank you so much, Scott.
Oh, you're welcome, sweetheart. You're always welcome.
Now the family will have to wait for the lab results to find out whether Maple's lump is cancerous or benign.
I'm just really hopeful, maybe just being a big softie, that as it's Nathan, my nurse's birthday today, that maybe a little bit of that birthday good luck will be sprinkled across Maple.
Happy birthday to you.
And the lump will come back as something we shouldn't be concerned about. Today I'm on a beautiful drive out in the countryside to see one of my favourite people in the world, Jill, who runs the Border Collie spot. She's given me a call because she's just received two beautiful Border Collie puppies. So she wants me to have a look at them, and of course when Jill gives me a call, I come running because I love this lady. Jill is a saint.
Curly! Curly!
She literally saves hundreds of Border Collies in the UK every year.
Border Collies are my favourite breed. I love their intelligence, their loyalty, they're real friends. I mainly take dogs from farms that are neglected, unwanted, abused. Hopefully I can help them and give them a better life. Good boy.
Hello, gorgeous Jill.
Hi, Scott.
How are you, lovely lady?
I'm fine, thank you.
Mwah. So who is this?
This is Mia.
Hello, Mia. Aren't you a pretty girl?
And this is her little brother, Ted.
Jill's two new rescue cases are 7-month-old siblings. Ted and Mia were found emaciated and riddled with worms. but it's the little boy's lame back legs that are Jill's main concern.
Such sad, sad dogs arrive here sometimes, and although sometimes it takes a long time, it's wonderful to see them recovering and the light coming back into their eyes. That's, I suppose, why I keep doing it.
Okay, Jill, so I need to see your little boy do a bit of walking. Okay. So do you want to walk over that way?
Come on, Ted.
Go on then, Ted.
Come on. Good boy.
It's not normal at all. He's very stiff on that back leg, isn't he?
Yeah, it's not right, is it?
It really is a very concerning moment when a young dog is lame and limping on a hip that should be completely healthy. They should be bounding around, and he isn't. And that really worries me for his future. Okay, I'm just going to extend this hip here.
Yeah.
Good boy. There's definitely something going on in this left hip.
Yeah.
There's a bit of clicking. He definitely resents me extending that hip. Ooh, does it hurt a little bit? Eh? For a young dog of his age, you know, he should have very flexible, very mobile hips, and this one, there's definitely some tightness. So I think that's probably the cause for his lameness at the moment. It's painful, he can't fully extend it, and in the worst case scenario, it could be something like hip dysplasia, where the hip just falls out of the socket. So what I think we need to do is take this young man to go and see my mate Michael, the orthopaedic surgeon, get him to have a little look. We'll do some examinations, likely x-rays, and look a little bit deeper into what the problems are.
Well, as long as we can do something.
Yeah, here we are again.
Yeah. The news Scott usually brings to me is that something is going to need major surgery and cost thousands of pounds that we haven't got. But even so, we always manage to find it. So no dog ever goes without treatment if it needs it.
Okay. Get you into the car, hey? Go see Michael.
Ted's been through so much, had such a terrible start to his life.
Say bye, Jill. Hey.
Hi, Ted. Good boy. And hopefully, if we get some good news today, he'll get into a loving home of his own.
That's it. Lovely. Good boy.
Bye.
Here you go, monkey.
45 miles away in Chertsey, these two puppies clearly don't have a care in the world. Scully belongs to Scott and his wife Zoe, and Branston is the pride and joy of Zoe's sister Maz.
Mouse, if your dog's going to be this out of control, we can't really do training.
Today, the pups are learning some new tricks.
Sit. Good boy. Oh, very good. Okay, we can match.
Okay, there we go, there we go,
Scully,
there we go.
Come.
And sibling rivalry is breaking out about whose is the smartest.
Shake. Good girl. So the plan today is a bit of training in the garden with the two puppies. And yeah, truthfully, see who's better. Scully, come. Come, sit. No, Branny, you're ruining it. No, 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 that's cheating, that's cheating. Sabotage, sabotage.
The pups have come a long way since Scott delivered them both by emergency cesarean.
Good boy, stand.
But now the lively pups are thriving.
Good boy! Good boy! Well done.
And it's hard to tell which mum is the proudest.
Hats off, which she can also do.
I think it would be unfair for me to say that one puppy's better than the other or anything like that.
Good puppy! Oh, she's a
But that's, you know, mainly because I think it was quite obvious that Branston turned round. He's just streets ahead on the training front, really.
Almost.
Sit. Sit.
Sit. I don't want to say this, but I think we know Scully was a little bit better. Watch this. Wait, Scully.
Wait, Branston.
Wait. Wait.
Branston, come here.
No, that doesn't count.
Champion.
No, that's not right. The best I'm prepared to accept is a draw.
All right, that seems
They're
fair.
both doing well.
Yeah.
All right. You're definitely the best. You're the best. Yes, you are.
Let's go see Michael. Good boy.
Near Marlow in Buckinghamshire, Scott has arrived to ask orthopaedic specialist surgeon Michael Hamilton to check out Ted the rescue pup.
I know, it's a Geordie. I know. It is a bit off-putting. Come on.
But the 7-month-old is definitely nervous about seeing his second vet of the day.
Come on. In you come. Come on. Oh, you're going to make me carry you, aren't you? Come here. Come on. Sleep. Come on. Hello, mate.
Hello, mate. Good to see you.
And you, and you. So this is Ted.
Yeah.
He's from Ireland. How's your Irish accent?
Poor.
Yeah.
Poor. Fairly poor.
Me too. Me too. I can drink a Guinness and that's about it. This guy, he is walking quite oddly on his back leg, on his back left. Today is a massive crossroads for Ted's life. It could just be that he has a slightly tight hip, that's a muscular issue that will resolve with physiotherapy or hydrotherapy.
Yeah, he's getting a bit tense there.
Or it could be as bad as a hip needing a total hip replacement. There's a massive spectrum there. We need to find out where on that spectrum he is.
Right, okay. All right,
Come on,
mate,
Ted.
Let's go.
Let's go for a run.
Go on,
Good
Ted.
boy. Come on, then.
To further assess Ted's hips, Michael needs to put him through his paces.
Good boy. That's it.
So the reason we've come out here is we need to see him at a faster speed and then ideally in a nice straight line. And this works perfectly. This little runway number 1.
Keep going. Good boy. Good
Yeah.
boy.
Go on, keep going, Scotty.
That's it, good boy.
And a bit quicker.
Good boy. Hope you don't find anything wrong with me.
Come on, Ted. He's got what I call the supermodel swagger. So as he moves, rather than kind of pulling his hip through, he swings his whole pelvis forward. So he kind of walks like he's got a pair of Christian Louboutins on. Let's X-ray his hips. Let's see how good or bad his hips actually are.
Ted's swagger could be the result of poor diet or a lack of exercise. But the main reason why young dogs like him walk like he does is a condition called hip dysplasia. That's where the ball literally falls out of the hip socket joint over time, and that causes painful rubbing of the joint.
X-rays.
If that's the case, Ted could need a total hip replacement. Now that's major surgery requiring weeks of rehab.
These X-rays will give Michael and Scott the answers and decide Ted's future.
So this is an X-ray of his hips. So these are the balls of the ball and socket joints. The balls are basically sitting quite well in the sockets. Yeah, I mean, his hips are actually pretty good. I guess he could still snatch defeat from the jaws of victory, but you know, they're pretty good. So I'm really glad we did that. I can only assume that some of his muscles and some of the soft tissues are just tight. Probably because he's had no exercise, he's had a poor diet, etc. But from a surgical perspective, there's nothing for me to do. There's nothing, no tendons to cut, no joints to replace, no broken bones to fix. So I think he's going to be fine. I think he's going to be fine. I'd be very surprised now, based on that X-ray, if he needs any intervention ever. So that's really good news for him. As he just does more and more exercise and becomes more and more of an athlete and gets a good diet, he's going to be normal.
Hello. That was a good little wake up, wasn't it? Hey, lots of good news to tell you.
I think it's great news for Jill today. I think it's the chance that she can now find a forever home for this beautiful little dog, give him the future that he's looking for, and we'll keep a close eye on him to make sure that he does reach his full potential. All right then, mate. Well, thanks very much.
No problem.
Yeah, Ted says thanks very much.
Yeah.
While Ted is still looking distinctly worried.
Good to see you, mate.
See ya. Take
All the
care.
best, yeah.
Bye.
Scott can't wait to deliver the shy puppy back to Jill and give her the news she's been hoping for.
So it's rare, Jill, that I get to speak to you about good news.
Oh, that's good.
Yeah. The X-rays actually show that his hips are relatively good.
I was really nervous about what you were going to be saying to me. So it's really good news, isn't it?
So I think what we need to do is to allow him to grow, but also in an environment which is healthy, which is going to get good food, therefore good nutrition, and also exercise, which is absolutely key to develop physically as he should.
Yeah.
And my hope is that the lameness that he's showing at the moment will come right once he's just using his body the way it was intended.
Scott has given me the most amazing news. It is just a case of bad nutrition and neglect. So with care and love, he should recover well and hopefully be rehomed soon.
I think if he was one of the 7 dwarfs, this guy, I wonder if would he be dopey or sleepy?
I don't say that. He'll never get home.
Good luck finding that new home, mate. You deserve it. Good boy. Yeah. Mwah. Good boy. You love me, don't you? Yeah, you love me. Here you are. Yeah.
Let's turn his ISO off for a sec.
At Richmond, nurses Emma and Nathan are preparing little Smitty for surgery.
Let's just move him up a little bit. 1, 2, 3.
His kneecap has been popping in and out of position, causing pain in the joint and making him limp. Now, Scott needs to fix the kneecap back into its groove to prevent arthritis setting into the joint.
I've just got Smitty on the table and I'm just really hoping that the knee looks okay when I get in there. I'm really hoping I won't see arthritic change, which would have a massive impact on his future. So I'm ready to make my first incision. So his kneecap, which is sitting here, you can see that's it popping out. So thankfully for him, can you see that, Ems, there's virtually no arthritic change there already?
Oh, that's very good. I love orthopedics. It is one of my favourite things to do. Everyone takes the mickey out of me around here. They call me the orthopod, and the favourite line is, Emma does love a good bone.
So this does look a bit gruesome. But you don't tend to like taking a hacksaw to a dog unless you have to. So there, we now have a groove. The surgery I needed to perform on Smitty was actually deepening the groove that the knee sits in and also tightening the tissues around the knee so that once I put the knee back where it should be, it'll stay there.
Smitty's owner, Molly, is upstairs, anxiously waiting for the operation to finish.
You never think you're going to be this nervous about your dog going into surgery, but it's nerve-wracking for me. It's scary.
Molly's booked to return home to the States for Christmas, but those plans will depend on Smitty's recovery.
He is my baby. I don't have kids, so Smitty is definitely my family.
You can actually see that that's wanting to stay where it should.
The good news for Molly is that the surgery has gone exactly as Scott planned.
That's set in beautifully. I'm loving my work on that one. All right.
I think we need to work on your modesty, Scott.
I went to modesty classes once. I was the top of the class. I was literally the best one there, yeah.
Why doesn't that surprise me?
It's not the nicest thing to go through, but it's no pain, no gain. And this is going to give him quite a lot of gain in the future. It's great news for Smitty because it means now he shouldn't skip or limp anymore. There shouldn't be any rubbing causing further arthritic change. Good result.
Well done.
Hopefully Molly will be happy. To be able to say to a worried owner, your dog's fine and he's going to live a pain-free existence, perfect.
There's
Mummy.
Hey, baby. Hi, sweetie. Oh, you're okay. Oh, you're doing okay. It was a little heartbreaking seeing Smitty drugged up, bandaged up, clearly not himself. Pulls at the heartstrings for me, but I'm really anxious to get him home. Any damage on the bone that was made by the rubbing?
Absolutely none.
Really?
Yeah, absolutely none.
Oh, I'm so happy. I'm so happy.
It was so
I'm
smooth.
so glad I did this when I did.
So it really
That's
does
good. So
mean
it's just
that-
full recovery.
That's right. Yeah, that's what we've got to look forward to. Is
Great.
Smitty will need to stay in overnight for observation.
You're okay.
But Scott's confident that he'll recover quickly enough for that flight back home to Texas.
I think it's great that we've done this before you go so that
Yeah.
you can settle into a new life in Texas.
Yeah.
And fingers crossed you won't need me anymore.
I know. Fingers crossed. Let's hope. All right. Well, that's just great news. I'm very happy. Yeah.
With Christmas fast approaching, Scott's been asked to do a favour for the owners of an animal farm in South Yorkshire.
I'm driving out today to see Andy and Keely, who run the Mayfield Alpacas Animal Park. And recently they asked me to pop up to help with their randy meerkat, Nguvu. Now this time it's not meerkats or alpacas even that are causing the problems, but a creature much more associated with Christmas. So I just hope that I can help.
Come on, Spinny. Come on, good boy. There you go. Good lad.
Hi, guys.
Hiya.
How you doing? Hey, Keely, good to see you.
Yeah, you too. Nice to meet you.
Hi, Andy. So, you've dragged me all the way back up to Yorkshire for reindeer. So tell me exactly what I'm doing today.
This is Sven, so he's our male reindeer. And then we've got Elsa over there. But it's Sven that I really want you to look at today. Scott's here today to help us trim the feet of a reindeer. So our reindeer feet, they do continually grow, so sometimes they splay out and then they can crack. So Sven's feet are looking like they do need doing. He does need a Christmas pedicure because he does have to look nice and sparkly, ready for his crowd. Sven's quite feisty, so yeah, he'll have his work cut out for him.
Let's just say they've got some Christmas spirit in them. We'll say that for the minimum.
It looks like a pussycat. What are you talking about?
Yeah.
I'm sure that if elves can do it, you can do it.
If elves can do it, I can do it. There we go. Kinley and Andy, you're playing it a bit cagey about how friendly or not the reindeer are. But look, it's Rudolph. What have I got to worry about?
If you just come through this way.
Okay.
In order to trim Sven's feet, they'll need to move him to the barn, where he'll be easier to control.
Let's go, come on.
Scott will need to get hold of his long lead and reel him in.
Oh, and they're off already. Oh my goodness.
Scott will give you those just in case.
Oh yeah. Thanks, mate.
Scott looks a little bit nervous.
Come on, Sven.
But Scott's a big Aussie guy. I'm sure that he can deal with the sort of power that's behind a small reindeer. It's nothing compared to a kangaroo or a great white shark.
So close. So close.
We usually try and step on the lead rope and then reel him in from there. Scott's method seems to be diving on the lead rope.
I was so close. Honestly, I had it.
Not a method that we usually use and not one I've seen before. It's comedy for us. We quite enjoy watching it.
Crap, are you kidding?
Definitely the reindeers are winning.
Oh my God.
He doesn't look like he's going to give up though.
Got him!
Keep on, keep on, keep on. Reel him in.
Come on, mate. Oh, man. Come on, Sven. Come on.
Keep nice and calm with him.
Good
and
boy.
Just be careful as you get him close to you.
Good boy.
The reindeers, they use their feet to kick and they also use their antlers to headbutt you as well. Yeah, try and hold as close up to the head collar as possible and then keep to the side of him. Just
Okay,
in
so
case
actually try and grab his head collar?
Just underneath you where the buckle is.
Okay.
And then you should be able to start walking
Okay,
him.
Sven.
That's it.
Good boy. Good boy.
Perfect. And then so you're at the side of him, both hands on the lead rope.
Good boy. There we go. Let's be friends.
That's it, you've done it.
But catching Sven is just the beginning.
Good boy.
Now Scott needs to walk Sven into the barn.
Oh, yeah.
But the young male is not surrendering without a fight.
I think the adrenaline's pumping in Scott. He is doing a good job. He's doing the right movements. He's talking to the reindeer.
Come on, come on. Let's behave nicely now.
I think the competition's on now to see who can hold on to who.
Whoa. Come on. Wait. Hey.
Do you know that Scully and her mummy and daddy and all her brothers and sisters are going to have, dun dun dun, a puppy Christmas party?
Really?
Back in London at the Miller House, Zoe is planning Scully's first Christmas party.
Not just any puppy party, puppy Christmas party.
Puppy Christmas cake!
Scott helped bring Scully and her 2 brothers and 3 sisters into the world. And now he and Zoe have invited them all to a special get-together at the Richmond practice.
Daddy, you look adorable!
I think it's going to be jam-packed at the practice when we get there. You think there's going to be me, Scott, and the kids just coming with Scully, and then there's another 5 puppies and everybody that goes with that. Who'll be more excited, the puppies or the people? I don't know. I think maybe the people might be the loudest.
Today, Zoe is kicking off the festive spirit with the help of Summer, Quinn and Jackson.
Yay, high five. Scott's off wrangling reindeer, getting Christmas on in a very real way, and we're here at home.
Excuse me, Mummy.
Can you imagine how much the kids would love seeing a real-life Rudolph? That would be amazing. So we thought we'd start things here, start decorating the tree, get our Christmas on with the help of my 3 little elves. It's looking good, kids.
Wow, this is gonna be a great Christmas.
He'll have a rest and then he'll have a fight, and he'll have a rest, he'll have a fight.
At Sheffield, Scott's been asked by Keely and Andy to do a foot trim on their Norwegian reindeer Sven.
Let's behave nicely now.
But just getting him to the barn for the pedicure is proving to be a massive challenge.
Calm down, come on.
Even though it does look a bit of a stressful experience, probably for all involved, not just the reindeer, it's something necessary they need doing. So as the feet do get longer and they do become splayed and cracked, that can cause infection and pain as well. We try and do it as quickly and efficiently as possible, even if it does look a bit manic.
Come on, Sandra's waiting. Honestly, it is like trying to dance with a big, massive reindeer. He keeps spinning me round and round in circles. He's bucking.
Not much further.
It's an absolute nightmare.
It'll just be a bit of a dance on the way up there.
It's funny to watch someone else going through that. Usually I'm the cannon fodder, but it's all practice. At least you'll have a good dancing skill at the end of it.
I'm not thinking it's ballroom,
No.
or if it is,
I think it is.
really bad. Now I know how Santa feels. It's so exhausting.
Nearly there.
Come on, mate. We're nearly at the barn, and honestly, I can't wait to let go of the halter. He's a beautiful reindeer, but I think we need to spend some time apart. Come.
Almost.
Sven will now be given some quiet time in the barn to let him relax before the foot trim.
Can you reverse park? Hey?
Here we are. Made it. Right, see if he's a bit more relaxed about everything now.
Let's hope so. I am after that break, I can tell you.
Yeah.
Back in Sheffield, the recalcitrant 2-year-old Sven has settled down enough for Scott to start his Christmas pedicure.
Hello, mate.
He actually looks a lot happier.
He does, much calmer,
Yeah.
breathing much more slowly and relaxed. That's good.
Scott's reindeer initiation has already been a revelation.
So close. Honestly, I had it.
But Sven's owners Keely and Andy are hoping it will all be smooth sailing from here.
Pedicure of a reindeer. I'm getting nervous again.
He looks quite happy now.
He does look pretty chilled now, but I've learnt my lesson from last time.
I am sending Andy in first. He does seem to like to go in there and get involved.
I know. This could potentially be quite a dangerous situation. Steady. So, as always, I'm used as cannon fodder. We've got not only antlers, you've also got the ability for the animals to kick, not from just from the front, but from the back. And they're not like other animals. They can kick to the side, they can jump and actively go for your face. It's definitely a hard task ahead. Luckily, Scott's on hand in order to try and sedate him if we need it.
Whenever we use sedation in animals, it's always coming at a risk. And for a big animal like him, we need to use quite a high volume. So if we can do it without the use of drugs, it's a much healthier thing to do.
After some serious push and shove, it's success for Andy and his assistant Nick.
There you go.
Right, going in?
Yeah.
And Scott can finally start on Sven's pedicure.
That's actually a really good position.
So I'm at the front and we've got Nick at the back. And at this point, all I'm concerned with is keeping the head down. Nick will keep his back end down and we should be safe.
How you going there, Nick?
Fine. I'm looking for any sudden movements. If the animal feels that you are relaxed in any way, shape or form, he'll take advantage of that and he'll jump up.
What's so incredible, Keely, straight away I see is he's got 4 toes.
Yeah, so they were like snowshoes then.
Yeah, so what,
walking
they
up
sort
the
of
snow.
splay out on the snow?
Yeah.
Amazing.
But it does a really good job.
All right, so how much of this, I can feel it's very thin there. Reindeers in their natural environment will wear down their feet by walking on rocky surfaces. When they're in a paddock, of course, the hooves are going to continue to grow, and that's why they need trimming. It is dead keratin, so it's not going to hurt, eh? Okay, mate. Happy with that?
Yeah,
All right.
very happy.
Okay. Nice, although what I'm concerned about now is I've sharpened it up quite a lot for next time.
It's got points.
Yeah, it's got points. So, Keely, how's my first?
Hey, that's good.
Pedicure on a
That is
reindeer.
good, yeah. Look at that. Nice and smooth around, a lot shorter.
Wow.
How it was underneath.
Maybe
that's good.
I've missed my vacation. Reindeer nail clipping. Nails by Dr. Scott. Available only at Christmas.
I think Sven's going to have a really good Christmas now. His toenails, they look really nice. He'll be ready to step out at Christmas, greet his crowds.
Good luck, Sven. Hey, I hope that Elsa's impressed with your new footwork. Have a good Christmas. This isn't my first trip up to Sheffield, and I don't know what it is about the animals up here, but I still don't think I'm any closer to making friends with them. I'm definitely not on Sven's Christmas card list. Oh, hello. That sounds like Smitty. Hello.
Back in London, Scott is making a Skype call to Texas.
Hi, mates.
Smitty recovered quickly enough from his knee operation for Molly to get back home for Christmas.
Who is that, Dr. Scott? Is that Dr. Scott? Don't worry, he can't do anything.
Luckily, scalpels don't go via Skype. It's fine.
That's right. But he's a happy little dog, and he's doing phenomenal. I think he likes being back in Texas.
It's so lovely to see Molly again, even if it is just through a screen. But Smitty seems to be walking really well on that knee. Life in Texas seems to be really agreeing with him. I've forgotten how beautiful he looks. You know what he looks a little bit like? A baby seal, I think. He's got those beautiful big brown eyes, doesn't he?
He does, doesn't he? When he gets those eyes going when he wants something.
Smitty. Hey, mates.
Wait a minute.
Oh, my goodness. Normally, as a vet, you get to see your patient over and over again. But in this case, Smitty was jetting all the way back to Texas with Molly. But I'm hoping they're going to have a fantastic and very comfortable Christmas now and many more to come. All right, Molly, lots of love.
All right, thank
Take care. Have a great Christmas, Smitty. Take care. Bye, guys.
Bye.
Ready, Teddy? You gonna spin? Good boy.
As for Ted, all his Christmases have come early. He's found the perfect forever home with Border Collie lovers Dorian and Kim, and their other rescue dog, Kenny.
Oh, good boy. Good boy. He's very fast. You're very fast, aren't you, mate?
Ted was found starving and struggling to walk properly. But once Scott and Michael cleared the puppy of hip dysplasia,
So that's really good news for him.
Spin. It just took the right diet and care to transform him from a sad, quiet Border Collie to this happy boy.
Whoa!
Good lad.
Good boy.
Now Ted's repaying that debt by helping heal his new owner.
Kenny and Ted have helped me in a way that I cannot explain. They are, that's special. They're my little boys.
3 years ago, Dorian lost his eldest son, Connor, after the 21-year-old had a tragic fall from a balcony.
It happened. Every family's worst nightmare, it happened. And Kenny was actually born 3 days after Connor died. And it was like, wow, you know, it was just one of those things that we had to get him. Good boys.
First Kenny and now Ted have been helping Dorian through his profound grief.
Then I'll have 5 minutes walking my dog. Big bold bloke with a beard, crying over there with a dog, you know. But hey, they don't know, do they? But I carry on, you know, and I look at my dogs and I just smile sometimes and get on with it, which you've got to do. You've got to do that. Teddy? Good boy, there you go. Another one? How many is that? 3? Another one? 4?
It's been a long journey for both Ted and Dorian, but this Christmas promises to be a very happy one for them all.
Good boy, Teddy. My advice to anybody that wants a dog is to go out and get one. Spin. Oh, very clever. You'll love it. You'll love it. It's life-changing. It's life-saving for so many people. You clever? Yes, you are clever. I know you're clever. I love you too, mate. Yes, I do. Yes, I do.
Oh, it's a shame, though, it's not night time. I think you'd get the real twinkle.
Just down the road from Scott's practice in Richmond, Everyone's starting to get into the Christmas spirit.
It'd be cute if we had a ball that you could hang from the tree.
The three sisters, Olivia, Ruby and Jasmine, their mum Jeanette and the three family guinea pigs.
She could be a decoration. She could be the angel on the top of the tree. We could give them stockings for Christmas. We could fill them up with like spinach or something.
Despite all the excitement about the upcoming festive season, there's been a shadow hanging over this close-knit clan. Scott removed an enormous lump from Ruby's guinea pig Maple and sent it off to be tested.
It really is absolutely huge. Hello, Merry Christmas.
Scott.
Now he's dropping by to deliver the results.
Thank you.
Such a big lump. You worry with something growing so rapidly as to what it could be, and knowing how attached Ruby was to her animal, you don't need anything awful to go wrong.
Let me have a little look at your beautiful girl. Hello, sweetheart. How are you? Very good news, young lady, in time for Christmas, is that the lump came back as something called a trichoepithelioma. It sounds awful, but in fact, it's a benign tumour. Nothing to worry about. And by removing it completely, it won't come back.
Thank you so much, Scott.
No worries.
I thought I was gonna lose her, but...
Oh, sweetheart, no. No way, no chance. Not before Christmas. That would be awful, wouldn't it?
Yeah.
Hey?
When Scott said that it was benign, I was just absolutely so grateful.
She can enjoy many more Christmases with you guys in this phenomenal tree. I can't believe it. That's massive. I could climb it.
Actually, I'm glad you said that.
Oh, really?
Because we couldn't put the angel on top of the Christmas tree.
Oh, wow. Okay. Gosh. All right. I'm going to need a ladder. Oh, man, that's going to be a stretch. Wait a minute. Oh. There you go. How's that?
Oh, no, now she's to the left. And she's looking down.
You're a hard taskmaster, I tell you, Jeanette.
A little bit to the left, just rotate.
How's that?
I think that's pretty good.
Yeah.
That's
Yay! Beautiful.
Avoid them round the bottom too much because we've got 6 very excitable puppies who will try and eat them.
Back at the Richmond practice, Zoe and Maz are in charge of the final preparations for Scully's first Christmas party.
I'm starting to think that this puppy party might be our craziest idea yet.
All Scully's 5 siblings have been invited.
Come on, love. Come on.
As well as her proud parents, Bonnie and Sebastian.
So amazing. They all look so similar now, don't they? I'm really excited to see all the puppies again because it was just such a massive event. They were born just downstairs here at the practice, so to have them all return with their new owners is just so special.
What could it be, dogs? What could it be? Oh my God! it's the whole family. Yes. I think it'll make Bonnie's Christmas to know that all the dogs are in good homes and they're happy. They're all with owners who love them, and they're all lively and energetic and clever and sweet.
Can I have a kiss? Oh, thank you. Lovely Christmas kisses.
To see all the puppies together is just fantastic and it's definitely given Christmas the sparkle without a doubt.
Thank you so much for coming. It's such a joyous thing to spend this moment with you guys. We've now all become this big, massive, happy, extended family. It's very, very special to me, and I just want to say thank you so much, and a Merry Christmas to you all. Merry Christmas.
At Scott's St Margaret's practice in southwest London,
We're gonna go see the vet. Yeah.
a rare Sphinx cat is about to make a grand entrance with his owner Marie.
Hello. Hi, Marie. How are you?
Oh, I'm at my wit's end, honestly.
Okay, what's going on with Banu?
Banu is in season and she's driving me crazy. She's been slightly amorous with my husband, Tim.
What's she doing?
She's rubbing her bottom all over him. And then, just to get him in the mood, she nibbles his ear.
I feel like I've walked in on a bit of a girly chat here.
We're just talking about my amorous cat.
Oh, right. Like you do. Hello. Okay, come on in, Marie. Banu is an incredible looking cat. She's a Sphinx cat, which naturally have no hair. They've got big eyes. They look a little bit like aliens. And she is really quite unhappy.
It is hilarious as she tries to mount my husband.
Wow.
And nibble on his ears.
Oh, she's trying to nibble on me as we speak.
You know, she does favour, apart from you, unfortunately, she does favour the males at this time of the month.
Okay, and when you say favour, what are we talking?
Rubbing her bottom on him and nibbling his ears.
Wow, it's quite intimate, isn't it?
It is.
Well, let's get you out and have a little look at you.
No, you're fine.
Hey, shall we pour you out? Hey, because you're a very emotional little lady at the moment, aren't you? There you go. Oh, wow. She's an amazing looking cat, isn't she?
Banu is a really affectionate cat. She's so loving most of the time.
Let's have a look at you. Okay. I know. Oh, dear. You are really in a mood today, aren't you? Dear me.
I think Scott's a bit scared. I'm not going to lie.
Oof. Hey? I love you, but I hate you.
I think he's slightly petrified of Banu.
When they can't enact their natural behaviours, they're going to get frustrated. Yeah. All right, baby.
I don't know whether she's in pain or not. I don't really understand it. But basically, what we have to do is we have to lock her in the bathroom with her litter, her cat food, and her bed. And it's the only place that she'll calm down.
Spaying will relieve Banu's torment, but first Scott must check if the frisky feline is healthy enough to undergo a general anaesthetic.
Normally when listening to animals' hearts, what we can hear in a healthy animal is lub-dub, lub-dub, lub-dub. All right, sweetheart. In the case of Banu, what I can hear is a small flutter, a little tiny sound, and that is not normal. It looks like her hormonal endeavours are going to have to continue for a little while because I can hear a heart murmur, which would suggest that part of her heart is abnormal.
Oh.
Heart murmurs really aren't very common in cats. It's like a ticking time bomb. One day they can be fine, and the next day they can be near death.
Oh.
But what also is a concern here is that, of course, to spay her, we need to give her an anaesthetic. And an anaesthetic in a cat with a heart murmur is very risky indeed. It increases the risk dramatically.
Okay.
So, unfortunately for now, you and your husband have to deal with that moody behaviour for a little longer.
Oh.
Banu will now need to go to Scott's referral hospital, the Royal Veterinary College, for a heart scan.
If they find at the Royal Veterinary College that she has an abnormality in the heart that's significant, then surgery may be the only option to allow Banu to live a normal, healthy life. So Marie has got a very difficult and tricky time ahead of her.
I'm pretty upset considering that Banu can actually die from this. I came in laughing this morning and now I'm leaving really, really worried.
Oh, it's okay, Banu. We're going to get you sorted, okay? Come on then. Should we take you to see Joe? And sort that little tooth out.
Next day, one of Scott's student nurses, Jess, arrives at the St Margaret's practice with her pint-sized pooch.
Hello, guys.
Hey.
Hello.
Vet Joe and receptionist Elle are on duty and very happy to see Poppy.
It's quite chilly.
But
Definitely
this is
getting
not
closer.
a social visit.
Well, Poppy's actually here because after playing with Kimber earlier, I've noticed I think she's got a wobbly tooth.
Oh, Pops.
It's really awful to see Poppy in pain with her tooth, so I want to make sure that we can get it sorted as soon as possible. She's definitely not herself.
Which tooth is it? Let me have a look.
This could be a little embarrassing for Jo because the culprit, Kimber, just happens to be her own dog.
Oh, is it that front one?
Yeah.
Oh, come on in. Let's have a closer look.
Okay.
Kimber and Poppy have been great friends ever since Jo joined Scott's practices 2 years ago and constantly meet up for playdates in the park.
She's gone that way.
I'm shocked when Jess tells me that Poppy's damaged her tooth, and even more so when I hear that Kimber may have done it when she was playing with her.
Oh, that looks really wobbly. Oh, Jess, I'm afraid that tooth is going to have to come out.
Oh, no.
Hey, Bobby.
A tooth that wobbly I can't really consider leaving in because it's got a big pocket around the tooth already, and that will just fill up with bacteria. It'll continue to wobble and cause pain and discomfort. In the end, it will fall out anyway, but there's a risk of getting an infection up there that's quite high if you leave a tooth that's that wobbly.
Oh, you're gonna have me really worried.
Do you want to do the anaesthetic?
I think I will. Yeah, Mummy be there when you wake up. I'm quite worried about Poppy and the anaesthetic. With anaesthetics before, we've had, you know, dogs' hearts will stop or they'll stop breathing. There's always those risks, those things can happen. I'd really like to be there, so I'd make sure she's okay, because she means a lot to me.
I'll give you first-class treatment, Pops.
Today I'm on the road to Yorkshire, one of the most beautiful places in Northern England, to meet an extraordinary teenager. This passionate animal activist is taking on some of the biggest names in business and winning. And today I'm going to lend a hand with the amazing work she does.
Hello, girls.
From her home in Sheffield, 170 miles north of London, 15-year-old Lucy Gavahan has managed to shoot to fame with a remarkable campaign.
Good girl, come on.
This teenager's mission is to stop the practice of hens being kept in small cages for commercial egg production and make sure they lead a free-range life like these lucky girls.
The hens really need a voice because they can't talk, they can't ask not to be caged. And the public can't see them in the cages because they can't see the farms. All they see is a box of eggs on a shelf. And if a dog was in a cage, there would be uproar.
In an incredible coup this year, Lucy managed to convince several of the UK's biggest supermarkets to gradually phase out the sale of caged hen eggs.
That was such amazing news to hear. So that's why I'm now petitioning the government to try and end caged hen farming as a whole.
Hi there, Lucy.
Hello.
How are you? Good to see you.
I'm good, thank you.
Hello, and who's this beautiful little girl?
This is Fern, and this is Sylvia.
Hello, Sylvia. You're looking very healthy. I'm going to let you in on a little cultural secret. As in Australia, we actually call them chooks.
Oh.
So, yeah, if I use the word chook, then don't look at me funny. But one thing I always love is the fact that chicken lovers tend to call them girls, don't they? Like, they're girls.
Yes,
like, you know,
they are girls.
Part of the girl power, part of the team.
Absolutely.
For her part, Lucy has adopted 6 rescue chickens and is hoping her campaign will encourage thousands of people to do the same.
Actually today, Phoenix Hen Rescue, where all these girls came from, they're having an intake of 40 rescue hens.
Wow, 40?
40. So if you wouldn't mind, it would be amazing if you would come and health check them and make sure they're all well on their way to a happy new life.
Oh, I'd love to. Sylvia, you going to come? It's... Oh.
Sorry. Sorry about that. Oh.
Made me very wet.
And she's still going.
Hey.
Oh, that's not what you want.
Let's go and rescue some of your mates, shall we? Sounds good.
So Scott and Lucy are now heading 12 miles down the road to Chesterfield to meet another animal activist, Kitty.
Hi.
She's asked Scott to carry out health checks on a huge new batch of rescue hens that are due to arrive today.
Hello, hi, I'm Scott. How are you?
Hi, Scott. I'm fine, thank you.
I hear we're welcoming 40 little girls.
It's actually more. We've managed to rescue 58.
Wow.
Right at the last minute.
My goodness.
They're here. The girls are arriving.
It's such a perfect day for the hens to arrive. They've never seen the sun before, they've never felt the grass or been able to scratch around. So it's so perfect for them to come out on a day like this where the sun is shining and they can just have the best experience they can do and a really nice welcome into the real world.
Oh, hello, girls. Hello.
Well, they're certainly not looking anywhere near as healthy as yours, Lucy, are they?
No, but they'll get there. They will.
This is the first step towards their freedom.
Absolutely.
Hey.
They're out now.
Let's start with liberation from the van, shall we? Come on, girls.
All these ex-cage hens were destined to be killed after they had stopped laying their daily quota of eggs.
These girls shouldn't go to slaughter. They have the ability to live a natural life, and why shouldn't they? That's the lucky last of the girls, and someone's laid.
Oh, really? Look.
First freedom egg at your end of the crate there.
Nice. Oh, that's got a good ring to it, actually. Freedom egg.
It's a freedom
I like
egg.
it. Yes.
It
Some
certainly is.
free chickens.
3 chickens and a first freedom egg.
And be brave.
At Scott St Margaret's practice, student nurse Jess is feeling on edge as her 3-year-old Jack Russell Cross Poppy is prepared for surgery.
Good girl.
Joe, the vet on duty, is one of Jess's closest friends.
There's definitely added pressure when the owner is right in front of you, because I know Poppy, and obviously Jess is worried about her, so I've got that added pressure.
Oh, model patient.
Joe's about to remove one of Poppy's front teeth, the collateral damage from a play fight with Joe's dog Kimber.
I think Joe is feeling a little bit guilty about Poppy's injury, but she has no need to be. They were just playing over the park and it was an accident.
All right, Pops. Gonna have a nap, eh?
Every anaesthetic is risky. At university, we're taught that it's reversible death, which sounds pretty dramatic, but it is that balance of keeping the patient asleep so they don't feel the surgery, but not letting them get too deep.
Oh, Poppy, you're very sensitive, aren't you? It is quite unusual being on a different side of things when it's your pet going under the anaesthetic. I'm a little bit stressed at the moment, just getting Poppy settled.
So this one definitely needs to come out. There's a massive pocket there. So that'd just get full of bacteria and should probably get an abscess there. So it would eventually fall out by itself, but it's much better that we take it out before she gets any pain.
Sounds good.
Nearly there. There we go.
Yay.
That's one tiny tooth.
Yay.
All right.
Oh, Poppy.
The tooth has come out easily, but with the surgery nearly complete, Poppy's heart rate suddenly drops.
What's her heart rate?
Poppy's heart has gone quite slow. It's dropped to about 20 beats per minute, which is really low for her. This could be quite dangerous.
You okay?
Don't want anything bad to happen to her.
So if we see the heart rate slowing down, then we need to lighten the anaesthetic, just slightly to bring them back up and bring up their heart rate again.
Am I just panicking?
Just taking nice breaths.
Yeah.
You okay?
Thank you. Yeah. I'm hoping that we never have to do this again because it is a lot of stress for me as well as everyone else.
Okay, we're all done. Are you relieved, Jess? It's all over?
Yeah, still a little bit tense until that tube comes out, I think. But yeah, no, I'm happy the worst part's over.
Oh, there we go. We're waking up.
Poppy! It is quite an insight to see how, other people feel when they put their animal in for surgery and anaesthesia, because it is quite a risky thing, although we do take every precaution to make sure that nothing bad will happen.
Hey.
Oh, hello. Little Poppy.
Hi! Mrs. Poppy.
Just a little bit gappy. Just the front one.
Still beautiful.
Very beautiful.
Poppy will be getting a lot of TLC tonight. She might even get some treats. I think she deserves it. You're very brave.
Kimmy wanted to see how her best friend's doing.
Oh.
She's very sorry about your tooth, Pops.
Oh, don't feel guilty, Kimber. It's okay.
They're very quiet, aren't they?
Yeah.
In Chesterfield, 160 miles north of London, Scott is getting his first look at dozens of rescued ex-cage hens.
And one of the common things is bumblefoot, which is the bacterial condition they get through the injuries. And I assume they get the injuries because of the fact they're standing on cage wire.
Yeah, it's just wire, yeah.
All right, good girl.
Scott is examining each hen to make sure they're healthy enough to go to new homes.
It's unlike Lucy's beautiful chickens at home. The comb is not only pale, but it's also flopping to one side.
15-year-old Lucy is part of a UK-wide campaign to rescue and rehome hens like these that have lived their entire lives indoors in cramped cages.
It's incredible to think that this is the first sunlight that they've ever had on their little faces.
Marie is one of the volunteers for the local Phoenix rescue group, which stepped in to rehome this new batch of hens that were about to be killed.
This is heartbreaking. I'm taking hen after hen out of the box and they're in such a bad way. Pale combs, feathers missing, emaciated. When you're feeling their breastbone, the keel bone here, hers is so sharp.
Yeah.
Yeah, we need to feed you up, don't we? Yes, we do. There you go. Oh dear, you're a bit worse for wear, aren't you, sweetheart? Oh, that's a very bald bird, isn't it?
Yeah, they get quite bored in the cages. Obviously, there's nothing for them to do. There's nowhere for them to scratch, to get out of the way of other girls. So they pluck feathers.
Of course.
And, you know,
From themselves and from each other.
And from each other, yes.
To see these animals firsthand and to see the state that they're in, it is really upsetting. But I think it strengthens the resolve of people like Lucy and people like me to try and make the UK free of any egg that isn't laid happily and naturally in a normal environment. Last one, okay? There's your pedicure done. Yeah?
Come on, sweetheart.
The good news today is that with proper nutrition and care, all 58 of these hens are going to enjoy a happy retirement.
This is their new beginning. With a little bit of time to heal, these beautiful girls will be able to go off to their new loving forever homes.
Oh, look at those, Georgie.
Lots of very nice chickens in here, or chooks as I like to call them.
Already, 5-year-old Georgie has arrived with her Aunt Chrissy to take home 6 of the hens.
Oh, who's that one? What should we call her?
William.
William? We can't call her William. She's a girl.
What about Billy?
Wilhelmina.
Wilhelmina.
Seeing the hens being rehomed is probably the best moment of it.
Don't tip my lovely chickens over, mister.
I won't.
Because that's when the hens are really on their way to their new life. And you know from that point on that that hen has a safe, secure future. And that's really brilliant to know.
Bye. Well, that was a lovely end to a hard-working day. I feel like my job is done. I better head back to London.
Well, there was one more thing.
Right. So after a very successful hen rescue, Lucy sent me off on, well, a fairly vague mission. She's mentioned about a cheeky meerkat at the alpaca farm that she lives nearby. So, as I'm a fairly cheeky chappy myself, I'm quite keen to check him out and see if there's anything he needs for me to do.
Let's go. Come on. Oh, it's okay.
At the Royal Veterinary College, Marie has arrived with her grumpy Sphinx cat for Banu's appointment with cardiologist Ilaria Speller.
Hello, you right?
Yes, I'm Marie.
I'm Ilaria, nice to meet you. Who we have here today?
This is Banu.
Hello,
Come to get her
Banu.
heart checked today.
Banu needs to be spayed to stop her sexual frustration and extreme mood swings. But recently, Scott diagnosed the 1-year-old with a heart murmur.
So we are ready to go.
Great,
Please
thank
come
you.
follow me.
Today, a scan will determine if it's safe for surgery to go ahead.
If Banu can't get spayed, it's going to be really stressful for the family and for Banu. But our main priority just now is the heart murmur and making sure that she's okay.
Oh, I love you. I know. It's all very scary, isn't it?
Banu is a big part of our family. Everybody adores her and loves her. So to think there might be something seriously wrong with her is really scary.
Okay, Banu, are you ready? Good girl. Some cats have murmurs that are not related to any disease, and some other cats unfortunately have a murmur, and that may impact their life expectancy and long-term prognosis. Oh no, we're sorry.
True to her recent form with Scott, Banu is proving to be a handful for the medical team conducting the scan.
Yes. She bit my nose.
I know, that's called jelly.
Here.
You tell us. Oh, I know.
I feel really nervous. I've got butterflies, and I think that's just not knowing what Ilaria's going to tell me about Banu's condition.
Ilaria, here we go. Baby, mommy's here. What we found during the scan is that she's got a little hole in her heart.
Okay.
But the hole was sealed. So we went hunting for other causes of the murmur, and we couldn't find any other. So the good news is that her murmur is not associated with any disease, so she doesn't need, any treatment. She can go ahead with surgery. She can be spayed. There is no evidence of any abnormalities, and that is really good news. She's got normal life expectancy, no problems at all. We consider her heart to be normal.
I'm so relieved that her heart is fine because we love her so much. I just can't imagine anything bad happening to her. And now we can get her spayed, which is amazing. Oh, thank you so much, thank you. I'll give you lots of cuddles tonight. Oh, brilliant, oh.
With the all clear, Banu will now be booked in for surgery with Scott as soon as possible.
This is the best news that I've had all week. We've been so worried and it is such a relief and I just feel less stressed already.
Come on, let's get you home. Get you lots of treats.
In Sheffield, South Yorkshire, Scott's been asked to take a detour before he heads home. He's about to investigate an unusual case at the Mayfield Animal Park.
Hi there. Hi, I'm Scott the vet. Lucy sent me. Apparently you've got a mischievous meerkat.
Nice to meet you, I'm Andy. This is Sooty.
Hello, Sooty. Well, you don't look like you're misbehaving.
He's not the issue. He's got an older brother that is causing lots of issues.
Okay, sounds ominous.
We'll head inside and we'll see the family group.
Okay. All right, lead the way.
We've got a problem with one of our male meerkats. He's reaching maturity and he's causing a little bit of trouble within the social group. So we need him to sort of come up with a plan of how we can change that and alter that so they can live harmoniously. So this is our family group. They're not as friendly, should we say, as little Sooty that you've met.
Not as friendly? They look very cute and sweet. They don't look like there'll be a problem at all.
Keep your fingers close. Your
Right.
body. Yeah. Take this area. And this
Your
area.
jugular. Oh,
and this
come
area.
off it.
Yeah. They work as a team. Yeah, you'll see it. The meerkats are very tenacious. They are very inquisitive. And unfortunately, with intelligence comes aggression.
The only adolescent male in the group, Nguvu, has been terrorising his female family members.
We've got one young man, and he's coming to his own.
Right.
When I say coming to his own, he's reaching sexual maturity in the fact that everything, like a teenage boy, is fascinating him in terms of female form. But the problem is...
We're talking urges, are we?
We certainly are.
Right.
But the only female forms in this group are his sisters or his mum, so we've got an issue.
Oh dear. Yeah. Obviously, it's completely inappropriate for him to have sexual behaviours towards his family members because inbreeding is a problem. But also for the poor boy, he's sexually frustrated. He is annoyed. He's therefore prone to more fighting. And that also isn't great for his health. So hopefully we'll find something that we can do to calm his urges. In dogs and cats, we would consider neutering them, castrating them to remove their testicles. Yep. But I can imagine that these guys are really quite dexterous with their feet.
Quite right, yes.
And they clean each other as well.
Yeah, there's a lot of mutual grooming goes on, so that might prove difficult.
Stitches as we close a wound is going to be quite difficult, isn't it?
Yeah.
Really what we need to do then is to, I think, look to some kind of drug, a chemical castration, something that will actually mop up all the testosterone. There's an implant that we can use, pop it under his skin. It'll have about a 12-month action and, that might just fix the problem.
Excellent.
This implant will temporarily cool down Nguvu's urges, but will not affect his long-term ability to breed.
It's a hormonal implant that gives a slow release of a drug that helps to dampen down the production of testosterone, the male hormone that stimulates sexual urges, and hopefully by reducing that down, it'll calm down Nguvu and he'll be a much better behaved son and brother.
Excellent. The male part of me feels it's not quite right, but...
Well, you know why?
Yeah, the keeper part of me does. Yeah.
Well, particularly as this drug is going to make him shrink. So that's a horrifying thought for any man.
Yeah, it's quite right, Yeah. Hopefully, it won't affect him too drastically. The implant is not physically taking away the testes. It will eventually come back, so it's a sort of temporary fix for a long-term problem. And in the end of the day, it's the best thing for the animal. So that's all that's important, really.
But even for keeper Andy, it's hard to tell one meerkat from another.
I think the issue you're going to have is trying to find him amongst all these meerkats.
Yeah, they all seem to look exactly the same.
You should be more worried about the attitude of the meerkats once he started doing the restraint. Those gloves are needed and he'll find out why.
So you're going to show me how it's done?
I'm going to stand back. I do this a lot. I'm going to let you have a go first.
Wow, thanks, mate. Excellent.
Confidence is key with meerkats. They're very confident, so you need to be very confident. Keep your bare fingers away from them.
Come on, Guvu. Which one are you, mate? It's going to be a guess, isn't it? This one's going to be... Oh, so close.
And don't get too cocky.
Ow, ow. Oh, man, he's got some teeth. Come on, Guvu. Which one are you, mate? It's going to be a guess, isn't it? Oh, my goodness, quick.
In Sheffield, Scott is trying to catch naughty meerkat Nguvu. But identifying exactly which one is the adolescent boy is going to be a challenge.
Just one thing I'll warn you about at this point is that when they're scared, they suck their testicles back into their body.
Don't we all? Right, 4 to go.
When Scott finally does track down Nguvu, the young male needs to be chemically castrated to stop his inappropriate advances to the female members of his family.
Not only are the meerkats lightning fast, but when you catch them, they're not impressed. All right. Ah! You. So I'm so glad I listened to Andy when he said, put the gloves on.
You've got a little girl there.
Gee whiz, I tell you what, I'm not doing well, am I?
You are, you're getting there, you're getting there. Unfortunately, he's not had much luck, and none of them are the ones we want.
They're so fast, it's unbelievable.
I think Nguvu is realising what's coming, so he's trying to avoid it.
Oh, no.
It takes several attempts before Scott finally gets his man.
Oh, there we go. Okay, let's see. All right, mate. So we've got the testicles there, which is great. You're very healthy, you're very strong.
Nguvu is showing extreme signs of aggression. You can see that it takes 2 of us to restrain the animal, and it shows how much testosterone is pumping through that little system of his.
Okay, I'm just going to take my gloves off to put the implant together.
Even with Andy holding on to the angry meerkat, it's not going to be easy for Scott to administer the implant.
Please don't get me.
Oh, I won't, mate. I won't. The implant is going to just add a slow-release chemical into his body, which will just depress his testosterone production and hopefully give a nice calm and serene feel to the new Nguvu. Good, I can feel that. Good lads. Do we both be angry as well, mate?
I think that positive relationship's gone.
Yeah, he's not going to have a beer down the pub with me now,
Not
is he?
at all, not at all.
Every owner of every animal, whenever we perform a procedure as a vet, they have some sort of follow-up monitoring that they need to do at home. Andy's, it's a bit interesting. It's not something I've asked for before, but I really do need him to take consistent photos of Nguvu's testicles.
That's all right, yeah.
It's so bizarre, I can't actually believe I'm asking it, but if we can see his testicles shrinking, we know the drug is working.
Okay.
And as they start to increase in size again, we know he needs the injection again. But fingers crossed, it won't be for 12 months. Right. Leave your sister and your mum alone. All right.
There we go.
Normally, I find that animals quite like me, but up here in Yorkshire, the chickens poo on me and the meerkats bite me. So I just hope next time round when I come back to Sheffield that the animals don't take another chunk out of me.
It's a day off for one of the practice's vet nurses, Gemma.
What do you think of the black lace, Fred? I think it's going to look really nice. It's very glamorous for Kimbies.
She's at home finishing off an important present.
Oh, she's going to look so pretty on her birthday.
A former fashion designer, Gemma's sewing a harness for Kimber, the rescue dog that recently disgraced herself when she unwittingly caused her doggy pal Poppy to lose a tooth.
Oh, don't feel guilty, Kimber. It's okay.
It's Kimber's only transgression, since her owner Joe rescued her overseas and brought her back home to London.
Jo was doing work placement when she was doing a veterinary training in Cyprus, and I think it was even on her first day, someone dumped Kimber on the doorstep. She was a tiny little puppy with these massive ears, really cute, and Jo completely fell in love.
That was 4 years ago. And this year, Gemma's helping to organise a special party to celebrate the anniversary of Kimber's adoption.
You like Kimber, don't you? She's your girlfriend, Fred. You see her at the party. It's going to be a really, really nice time, and I think Joe's going to love it. What do you think, Fred? Do you think Kimber's going to like it? I think she's going to look beautiful in this. Look nice on you, actually. Maybe we'll make you one too.
Hey, Marie, how are you?
Good.
First of all, hug for great news.
Marie and Banu are back at the St Margaret's practice after the 1-year-old Sphinx cat was cleared of a serious heart condition.
Well, we're not completely out of the woods, because obviously today we are going to have to spay her and try and reduce her sex-pestering ways.
The moody little miss can finally have the operation she needs to get her raging hormones under control.
We're just hoping from the operation that she can be her usual happy self that she is 9 times out of 10.
Come on.
Wow. Beautiful jumper.
Well, you know, we're coming into colder times now. Yes, Mummy needs to get a matching one.
Banu comes out of the cage and is wearing a lovely knit jumper, of which Marie is very proud of. Knit jumpers on a Sphinx cat? You know, okay. Are we being serious with this? I mean, Banu, you look ridiculous.
What's wrong? She looks gorgeous.
Ooh, wow, she is loving me today. It was because I mentioned your fashion. You never comment on a lady's clothing.
Never diss a woman's fashion.
All fashion jokes aside, it is a serious day for this little lady. Now we just need to get you through this and hopefully you'll be a bit less cantankerous. Could you try? No. That's the answer. A resolute no.
No.
All right, do you want to say goodbye to Mummy?
Oh, goodbye. Oh, I know. I love you. Banu is part of our family. She's like our 4th child. Everybody just adores her and loves her. I'll see you after. Be good. Well, okay. Bye. Bye, I'll see you later. Bye.
Bye, see you, Marie.
So obviously we're going to be worried about her today going under anaesthetic, but I know that she's in really, really good hands with Scott.
Come on then, Chuckles. Hi, Jess.
Hello. Oh, my goodness. Hello.
Yeah, very, very happy customer. I'm just hopeful that because you don't look dissimilar to her mum, that she might like you a little bit more than she likes me.
Hey, it's okay. Hey, Banu.
But Banu soon makes it clear that Jess is not going to placate her.
Whoa, wowza. Right, so just because she is so mad and so stressed, rather than trying to give her an injection, I think it's best we just give her some gas, calm her down nicely, and then we can move forward with the spay. All right, so we're ready?
Well done.
Good girl.
It's all right.
Good girl. Even though we have proven that her heart is okay, I still think she is a patient that we want to watch very closely.
Oh, that's better.
That's the one. Okay, so she can just flop over there.
Banu is finally under, but it's not long before Scott is feeling even more pressure.
She's just not breathing right now. Sometimes they just go down quite deeply, and although the anaesthetic was given very, very gently, Banu has stopped breathing, and it's an emergency situation right there. Come on. Come on, take a breath. She's not breathing right now, so we just need to encourage her to do so. Good girl.
At the St Margaret's practice, it's a tense moment for Scott and Jess.
Come on, sweetheart.
Banu has stopped breathing after being anaesthetised.
Is that her?
Is that her?
Yeah. There and again. Yay, good girl.
Okay. Yet again, Banu, you are trouble. Yeah, that's much better. So Banu decided that she wasn't going to breathe for a little bit longer than is comfortable. So I think she just wanted me to sweat a bit. So.
Did you?
Oh, yeah. Yeah. You know there's problems when Jess and I aren't saying anything.
When it's gone quiet, that's
when it's got quiet, then you know there's something. Yeah. Okay. I wonder if it's because I was mean to her about a jumper.
I was going to say, do you want to keep that on and we just tuck it up?
Just as long as you breathe, I don't care what you wear. Just, there we go. Breathing is good. Jumper optional.
With Banu now stable, the spaying of the highly strung Sphinx cat can safely begin.
All good up this end, Scott? Yep, happy.
Okay, so just about to cut.
The surgery involves removing both Banu's ovaries and much of her uterus.
So although this is a fairly routine procedure, I think for this cat it's going to make a huge difference to her quality of life. This is a very hormonal, very stressed lady, and removing the factory for the hormones, the ovaries, is going to make all the difference in her life. There's one ovary there and you can see it's very active, and this cat is a very hormonal girl right now. I have to be careful what I say. I'm surrounded by women, so I can't say anything bad. Yeah. Jess, we're all done. She can wake up.
Lovely.
All right. Don't know if she'll like me anymore before or after the surgery. It's so hard to tell.
We'll see.
I'm really happy that Banu has come through the anaesthetic. Initially a little bit of a scare for us, but she's come through perfectly fine, and she's going to recover from this and hopefully enjoy a hormone-free life.
Upstairs, Ona Marie is anxiously waiting for Banu to wake up.
I'm really excited to get her back and give her some cuddles and give her some TLC and know that she's okay.
Right, let's see how much happier you are after that spay. Oh, maybe not so much. Hey.
Although her reproductive organs have been removed, it will still take several weeks for Banu's hormone levels to settle down.
Come on. Oh, Banu, goodness. Wow. What was all that about? I must say, I'm a little shocked at how Banu has behaved towards me. I'm hoping it's just hormones, and that given a few weeks, once they've calmed down, I can go and see her at home and she'll give me a cuddle. Fingers crossed. Hi, Marie. Here's your little treasure.
Oh, hello, baby. What have they been doing? I know you're going to be so angry with me. Do you want to come and see Mommy?
Yeah, I think so.
Oh, I know.
Is wholeheartedly unimpressed
I know.
with me.
Oh, I know. It's okay. It feels really good to get Banu back. I've been worried all day about her, and just to see that she's okay is brilliant. Well, thank you so much for looking after her.
It's been a pleasure. Or has it been? It's certainly not been a pleasure for her, I can tell you that much.
Hopefully you'll meet her when she's a bit nicer. No frowning. Too young for Botox. Keep your face calm.
Doesn't this cake look great?
Also in St Margaret's, receptionist Elle is holding a special party at her house.
So not an H in the packet?
No! Happy birthday.
Kimber won't mind.
She won't mind.
I don't think she can spell, so I think it
Elle, Gemma and Jess are waiting for their workmate Joe to arrive, with the guest of honour, Kimber.
Oh, everything's ready. Doggies are ready for their cake.
Doggies are ready. Are you ready for your treat? Oh, Kimber's here. Happy birthday.
It's been 4 years since Joe rescued Kimber in Cyprus.
Look, it's got you on it. Kimber's, it's you.
So sweet. Having a dog has completely changed my life, and Kimber is so special. Everybody loves her. And it's so nice to be able to have that bond with a dog. It makes me a better vet. I can sympathise and empathise with my clients. I really can relate to them.
What's this? Let me help you open it. Everyone wants to see what it is.
And now it's time for Kimber to inspect Gemma's surprise present.
Do you like it?
Oh, that's so sweet. Should we put it on you?
You look so beautiful. You're sparkling.
Thank you so much, Gemma.
You're welcome.
It's beautiful, isn't it, Kimbies?
It's nice and glamorous.
It's very glamorous, and she's very glamorous. I'm so lucky. I work with a really amazing group of people. Everyone's got their own pets, and we really bond over the fact that we all love our pets to bits.
High five. Yeah!
It's so sweet to have a party to mark Kimber's adoption. I mean, it's a bit of a weird, bonkers thing to do, isn't it? But I'm sure we're not the only people having a party for our dogs.
Happy Adoption Day, Kimbies.
I think it's safe to say that the adoption party has been a big success.
Oh, she likes that.
A good girl. See how happy she is, Jude?
Yeah.
And 1 week after being spayed, Sphinx cat Banu finally appears to have calmed down.
Oh, is that nice? Is that
a good spot there?
I know. Oh dear, you are really in a mood today, aren't you? Dear me.
Prior to her operation, the feisty feline was consumed with hormone-induced frustration.
Oof. Hey? I love you, but I hate you. All right, baby girl.
Now she's a picture of serenity, giving cuddles to her owner Marie and her son Jude.
Good girl, Banu.
We are so happy to have Banu home. Her recovery has been fantastic and she's calmer already. I know Scott said it would be a few weeks, but there's definitely a difference in her behaviour already.
But the big test is whether Banu will finally relent and give a warm welcome to Scott.
Hey Marie, how are you?
Scott, good. How are you?
Really well,
Nice
thanks.
to see you. You want to come
Trust
in?
you, well, I'll see. How do you feel things have gone? Do you feel like it's made a big difference?
It's made a really big difference. Already she's calmer. It's like she's happier. Like we've released her from the burden
Of hormones.
And she's like, I'm so much better.
And now the big test is to see if actually she is a bit more, well, nice to me. Can I sort of stroke you a little bit? Banu is reacting the way Banu does. She hates me. Oh, yeah, pound of flesh and all that. Oh. I think she really is unimpressed about my presence in her house and in her life generally, but I'm really happy to report that it seems like her life has got much better in the presence of Marie and the family. Oh, hello. Oh, well, that's an improvement. And you're going to launch. Oh, wow. I feel honoured.
Oh, that was progress.
That was progress, yeah.
That was big progress.
Yeah, I could touch her without her savaging me.